everyone. This is a public hearing of a joint committee of Public Safety and Public Health and Human Services regarding resolution number 200690. And before we get started, I'd like to recognize Ms. Samantha Williams, Esquire, to read a required announcement.
Thank you, Mr. Chairman. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We're using Microsoft Teams to make these hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligence prior to the hearing, and can also be found on phlcouncil.com. Everyone who has been invited to the meeting to testify should be aware that this meeting is being recorded. And because it is being recorded, participants and viewers have no reasonable expectation of privacy. By continuing to be in this meeting, you are consenting to being recorded. Additionally, prior to Councilmember Jones recognizing members for questions or comments they may have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Thank you.
Thank you, Ms. Williams. And at this time, would you please call the roll, and members that are in attendance signify and also say a few words so that your image will appear on the screen.
Councilmember Johnson. Councilmember Thomas.
Present.
Councilmember Green.
Present.
Councilmember Gautier.
Present.
Councilmember Gim.
I am present.
Councilmember Brooks.
I'm present.
Councilmember Heenan.
Good afternoon, colleagues. I am present.
Councilmember O.
Good afternoon. I am present as well.
Councilmember Bass.
Good afternoon. I am present. Thank you.
And Chairman Jones.
Present, and thank you, Ms. Williams. A quorum is present. This committee will now come to order, and I'd like to recognize my co-chair, Councilmember Bass, for comments.
Well, good afternoon, Mr. Chairman, and good afternoon to my colleagues. I'm going to be very brief so that we can get into the testimony. But obviously, we had a hearing back in December of 2020 regarding COVID within the prison system and the effects on those who are incarcerated as well as those who are working within the system. We have since that time we have had several conversations with different entities to ascertain exactly what is the condition, what is the status of basics being provided, such as PPE, social distancing, and following safety guidelines that we know work within the prison system. We received a response from the administration from the questions from December just late last week. So I believe on the 12th and the 14th, we received responses to our questions 3 months later from Commissioner Carney and from the Mayor's Chief of Staff, Mr. Engler. And so because we received them so late, we haven't had the thorough chance to review them as much as we would have liked. But I will save my questions for the testimony because we do have some questions based on generally having a quick look at what was provided just recently. So thank you, Mr. Chairman, and I look forward to the testimony.
Thank you, Member Bass. Are there any other members of the committee who would like to have a statement at this time?
Yes, sure. Mr. Chair.
Member Johnson.
Thank you, Mr. Chair. Mr. Chair, I just want to thank my colleague, Councilman Cindy Bass, for staying on this case. In the midst of COVID-19, I have talked to a significant amount of my constituents who have family members who are incarcerated, not only in the city of Philadelphia, but all across the state of Pennsylvania. And we recognize that although individuals are incarcerated, they are still deserving of their basic human rights and dignity while they are incarcerated during this health pandemic. And so I thank you for your follow-up. And hopefully, as we move forward, we can continue to make sure that we're addressing this issue and making sure that the family members feel some level of relief that their voices are being heard around this particular issue. Thank you very much, Madam Chair, Mr. Chair, and Madam Chair.
Thank you, Member Johnson. I recall our trips up to upstate, so your advocacy didn't start with COVID. It started quite some time before that. We appreciate your constant vigilance. Ms. Williams, will you please read the title of the resolution?
Resolution number 200690, a resolution authorizing the committees on public safety and public health and human services to conduct joint hearings to examine available options for protecting Philadelphians in the Philadelphia jail system and the Pennsylvania prison system from COVID-19.
Thank you so very much. Can we now hear the first panel to testify?
The first witness to testify is Commissioner Blanche Carney.
Commissioner?
Good afternoon.
Good afternoon, Commissioner.
Good afternoon, Chair Members Jones and Bass and members of Committee of Public Safety and Public Health and Human Services. I am Blanche Carney, Commissioner of the Philadelphia Department of Prisons, and I'm accompanied today by Deputy Commissioners Terrence Clark, Xavier Buford, and Terrell Bagby, Chief Medical Officer Bruce Herdman, Chief of Staff Greg Brado, and our Contracts Administrator Deborah Snyder. Thank you for inviting the Department of Prisons to provide updates for resolution number 200690 regarding COVID-19 and its impact. Since the prisons last testified on December 1st of 2020, the Philadelphia Department of Prisons continues its mitigation efforts to reduce the transmission of COVID-19 inside its facilities to protect staff and inmates. The PDP continues to work closely with the Philadelphia Department of Public Health and follows Centers for Disease Control guidelines for correctional facilities. The PDP continues to manufacture cloth masks and is on its third iteration of design, resulting in a 3-ply mask. PDP continues to provide cloth masks and non-surgical masks for staff and cloth masks for staff and the inmate population. The masks are readily available for staff, some for those who choose to wear them. Staff who choose not to wear the 3-ply cloth mask wear their own non-surgical masks. Staff must wear a mask at all times. Inmates are issued 4 cloth masks at the time of admission and have multiple masks since the inception of COVID-19 pandemic. The PDP exchanges damaged masks for new ones each Wednesday. Inmates order their masks each week with their assigned clothing and linens. Inmates must wear a mask at all times outside of their cells. To date, the PDP has distributed 104,992 cloth masks to staff in the inmate population. In addition to the cloth masks, staff have been assigned levels of personal protective equipment commensurate with their posts. The assignment of our PPE was modeled after the medical model, ensuring staff working with COVID-19 positive inmates are issued the highest level of PPE, such as N95s, gowns, and aprons, and with general population quarantine areas issued appropriate level PPE such as the KN95 non-surgical and cloth masks, with all having access to gloves. PDP has an ample supply of PPE on hand and continues to issue to staff accordingly. The PDP continues to provide masks, soap, and cleaning supplies for inmates to maintain their personal hygiene and to clean their cells and common areas. PDP installed plexiglass throughout its facilities and housing unit areas, offices, lobbies, and official visiting areas. To date, we have installed a total of 228 Lexan partitions, known as plexiglass partitions. Hand sanitizer dispensers continue to be available in staff common areas, lobbies, and official visiting areas. Staff has also been approved to enter the facilities with their personal size hand sanitizers. Floor markings and signage remain placed throughout the facilities as a visual indicator for staff and inmates to practice social distancing to the extent possible. Thermal screening for staff remains in effect at all entrances. PDP continues to enforce that everyone presenting with COVID-19 symptoms or has a high temperature is sent home to self-quarantine for 14 days, encouraged to test. And anyone reporting contact with a COVID-19 positive person is also required to self-quarantine. PDP continues to conduct contact tracing accordingly. PDP created educational campaigns regarding COVID-19, mask wearing, and flu immunization that are presented to staff and the inmate population respectively using our closed-circuit TV system. Lunch periods remain staggered and roll calls for uniformed staff remains relocated to large areas to allow for social distancing. Enhanced sanitizing protocols remain in place. PDP continues to test all inmates upon admission and maintains a 14-day quarantine period in accordance with the CDC guidelines. Symptomatic inmates continue to be immediately isolated and tested, while the symptomatic inmates housing is placed in quarantine, where all inmates housed on the unit are serial tested. Any asymptomatic positive inmates are placed in isolation. Quarantine is lifted only when there are no longer any positive patients on the unit. PDP's infection rate was less than 5% for 6 months of the pandemic. In early December of 2020, we experienced an uptick in positive cases, which required the PDP to return to shelter-in-place status in order to manage the potential spread. Housing units were placed in quarantine and isolation respectively. This decision greatly reduced the number of positive cases in the ensuing weeks. This action was followed by universal testing of all staff, and a second round of universal testing of all inmates was conducted in early January 2021. The testing revealed a 1.2% infection rate for staff and a 6% infection rate for inmates. As a result of the improvements in our infection rate, the PDP lifted the shelter-in-place mandate in early January 2021. Effective February 10, 2021, PDP permitted inmates to leave their cells for 2 hours per day, and effective February 24, 2021, 3 hours a day, which remains in effect. Overall, PDP has performed over 22,000 COVID-19 tests, and in that significant number tested, the infection rate for inmates is below 7%. Both universal testing of inmates in May of 2020 and January 2021 revealed an infection rate of 6%. Other prison settings locally and nationally have had infection rates at least double that percentage. I believe these statistics reflect our efforts to mitigate the spread of the disease inside our facilities. PDP continues to monitor for outside introduction of COVID-19, which can occur through off-site clinic trips, hospitalization, and court-related appointments. If a positive case is identified with staff at one of the criminal justice partner agencies who may have had contact with the inmate population during off-site court proceedings, the PDP safety officer is informed and contact tracing commences. Effective May 5th, 2021, the PDP has implemented a COVID-19 rapid test to be provided for all inmates scheduled for court to further protect staff in the criminal justice community. PDP began its vaccine program in February 2021. PDP receives its doses from the Philadelphia Department of Public Health and equally offers doses to staff and inmates. Staff assigned to intake and isolation housing areas and the hospital wards were first offered the vaccine, and inmates assigned to these units and those with compromised immune systems or medically vulnerable. Vaccine doses continue to be offered to staff and inmates at all facilities. PDP continues to offer doses to staff on site, making it easier for them to receive the vaccine. PDP continues to make available virtual legal visits and virtual court proceedings. The court resumed in-person court hearings in January 2021. PDP continues to make available in-person legal visits requiring the inmate and the visiting attorney to wear their mask at all times, seated in chairs that provide more than 6 feet of social distance. PDP continues to provide weekly lists to the courts, district attorney, and defenders for consideration for early release. On March 5th, 2021, the PDP implemented inmate schedule for court to receive that rapid test. Only inmates tested and medically cleared are permitted for transport to court. PDP continues to use the First Judicial District court portals for the Defender Association to conduct virtual legal visits from 2 to 10 p.m. Additionally, the PDP continues offering the virtual tablet platform for legal and civilian visits, respectively. Tablet legal visits, virtual visits since October 1st, 2020, and civilian virtual visits since December 15, 2020, continue to occur and are heavily utilized. The PDP continues to offer Zoom virtual legal visits as well. There have been 2,925 virtual legal visits and 219,148 virtual civilian visits for friends and family, 7,914 in-person legal visits, and 6,227 legal visits via Zoom. The PDP continues to address the operational challenges driven by COVID-19 using our best efforts to keep staff and inmates safe. We remain fully committed to working with our fellow criminal justice partners to continue to safely effectuate increased proceedings to reduce the prison population. Thank you, and I will be happy to respond to any questions.
Thank you, Commissioner. Time flies, even in pandemics. I recall the first time we, and based on a emphasis of the organization power, to take a look at what was going on and how you guys were faring on State Road. So let me do a couple of questions before I turn it over to my colleagues. So when was your first case of COVID-19 realized?
The first case we realized was in April.
And subsequently, was that an inmate or a staffer?
It was an inmate.
Since then, how many inmates have been affected by COVID, and were there fatalities?
I'm going to have Dr. Herdman present our numbers. We've had one inmate death related to COVID-19, and we have had 3 staff related to COVID-19.
So I was going to go back to staff. How many cases of COVID among your staff?
Councilman, we were reporting, and we continue to report that information to the Department of Public Health. It is not identified and separated out for staff and inmates. It's in aggregate, and we've provided that information from the onset, and we continue to do so. What we can share with you is the infection rate when we did the testing, with the one-time universal testing of staff being 1%, and then the 6% of the second round of universal testing. From the onset, the city is reporting COVID positive cases in aggregate. It's not differentiated by staff or inmates. What we can share with you, and Dr. Herdman will respond shortly, is the total number of symptomatic and asymptomatic inmates.
Okay.
Councilman Jones, can I just point of information?
Remember again.
We have repeatedly asked for this question of what are the specifics by this department. And Commissioner, there are 3 city staff workers, your employees, who have died of COVID. It is our right to understand if you are sharing that information with health department does not publish those numbers on its website. It is not made publicly available. Are you telling us, because this is asked before, are you telling us that the department refuses to share with the city council committee the specific numbers on COVID testing and positivity with this committee? That's a yes or no question.
The answer is no, because we have repeatedly responded to this inquiry. We've explained to you how we're reporting that information. We gave you last the last testimony, our infection rates, and we informed you that we share that information. That is the city's response. We're providing that information to public health.
So you will not share it with this city committee?
Not
you will
based
only share it with public health, is that correct?
Based on your question, yes.
Okay.
And what?
I needed to, Councilman, I'm going to let you take it from here, but I want it on the record that the commission, this department will not share with us directly. And if we want this information, we have to go to health, which I consider to be not appropriate. I think it is our responsibility to ask the department to publicly state what the COVID positivity rates are for people that we mandate to be put into these prisons, including for right now, young people, children who can be put into an adult prison. So I do want it on the record. Your question has been asked multiple times. The department is not going to concede. We either have to go to the health department or to the mayor, but we will not get that answer otherwise.
Commissioner, is there a reason?
Point
of information recognized Council Member Green.
Yes, point of information. Under our rules, if we need to subpoena information, we're able to do that as a legislative body. We don't have to put that in the resolution. That information is part of our rules if need be.
Understood, Member Green. Thank you for underscoring that. Commissioner,
yes.
Can you elaborate as to why you are reluctant to share that with us today?
I'll respond. From the very beginning of the COVID-19 pandemic, the city established that the information would be reported in aggregate. It was not where we would say how many staff, how many had tested positive. We have provided that information. It is on the city's website. We're aligned with the approach that the city has taken. We've reported that information to the health department. That information is on the website. And if you would allow us to have Dr. Herdman join us to give you some of that information. Now, this is a question that has been repeatedly asked. We've been consistent to align with the city's approach. This is not a prison approach. This is the city's approach. We do understand other jurisdictions report information differently, but from the outset of COVID-19, we've been consistent. Dr. Herdman, if you can join us.
You're in my hearing.
Okay.
You're in my hearing. Give me a second. Because I just want to, for the final time before, you said to me that you report the infections, not making a distinction between staff and inmates, correct?
Correct.
What is the total number for both staff and inmates?
We're going to share this information that we have now, if you would allow, if you would permit us to do so.
All right. Let's indulge.
Okay.
Go ahead.
Okay, Dr. Herdman.
Good afternoon.
Good afternoon. Can you state your name for the record?
My name is Bruce Herdman, and I'm the Chief of Medical Operations for the Philadelphia Department of Prisons. The foundation for what we do at the prison is the Center for Disease Control guidance for prisons and jails, which was issued in February of 2020. As the commissioner says, there's significant detail in there about what we're supposed to do, recommended to do for screening and testing and sanitation and PPE, what kind of PPE and who's supposed to wear it and in what situations, social distancing, contact tracing, and quarantine and isolation, and when people go in and out of that. And it's been compliance with those recommendations that has led us to have what I think are quite favorable numbers, not perfect. Commissioner, can we have that slide shown?
Dr.
Graph?
Yeah, I don't believe we have that up. We'll see if we can get that up for you.
We'll share with you a graph that shows from the onset of the pandemic, the infection rate is reported by the city, and then as compared to the infection rate for inmates inside the prison. And it also shows the universal testing that, as the commissioner said, was done twice, and twice for inmates and once for officers. The rate for inmates was 6% in most recently, and 1% for staff. That's not just officers; that's maintenance, food service, healthcare, all the staff that work at the prison. We're currently doing testing of everybody at intake. Of course, an inmate can refuse to be tested, but that's fairly infrequent. And we also test whenever there's a situation where there's a symptomatic patient. Even before we've gotten the results on that patient, that patient would be put in isolation, and the unit from which they come is put in quarantine, and everyone is tested on that unit, and then tested every 7 days until, as the commissioner said, no one tests positive, and then the unit can come out of quarantine. We've done more than 22,000 tests over the course of this pandemic, and our current rate is about a 2% infection rate, and virtually all of those people are asymptomatic, which is good in the sense that they are less likely to infect other individuals. Nevertheless, they're in quarantine, so that we don't expose other people to people who are positive for COVID. Part of our effort has been the education of staff and inmates about what is this disease and what it is not. It's not, and what are the vaccines that are available, and how do they work, and what do they not do? Because there is considerable concern.
You're taking me down a long path.
Oh, I'm sorry.
I have a simple question. Since the pandemic, how many people have tested positive, not percentages, actual numbers,
yes,
from COVID?
There were 275 symptomatic as of yesterday and 1,027 asymptomatic. And that's for all the people who've been in the jail over the period since the beginning of the pandemic.
And what number would that be?
The total number is approximately 1,300 total. Oh, I'm sorry. The total number would be about 24,000.
Okay. All right. And so, of those infections, how many required hospitalization, and how many were fatal?
We've had a dozen people that were hospitalized, and of the inmates, I think we've had one confirmed death. There's possible others who might have been released prior to their finishing their hospitalization. We don't have the information on those, Councilman.
All right, Commissioner, I have one question. I'm going to turn it over to my colleagues. What was the inmate population at the beginning of the pandemic? What is it now?
So today's census is 4,778. And at the beginning of this pandemic was 4,209. And so we have a longer length of stay because the court proceedings were curtailed significantly, and our average length of stay has significantly increased given the impacts of the court-related operations. Our admissions are outpacing our releases. And so that's why we have that increase in the inmate population. So our admissions are outpacing the releases.
Sam, who's teed up to ask questions next?
Councilmember Gim, did you still have questions?
I do.
Chair recognizes Councilmember Gim.
Thank you very much. So I guess I would ask, Dr. Herdman, the numbers that you released today, where can we find them publicly available?
They're published on the Philadelphia Department of Prisons daily website page about COVID.
Okay, so they're on the prisons
website. Public Health Department.
Public Health Department's public website page.
Yes.
And how do you update it
every day.
Okay. So then is it just like indicating like growth, increase, change, or is it just an aggregate that's kind of like collected?
For symptomatic and asymptomatic, it shows both the current number and the total number.
Okay.
And then you can see, Councilwoman, you can see every day's data, so you can see what the change is from day to day.
So that would help. Commissioner Carney, it would help to know that those are being published and that it's not, it is available. I think that was the question that we wanted to make sure of, that this information is publicly available. So that's important. Going back to your statement, so you said that there were something like 1,200 asymptomatic cases, 285 symptomatic cases. So does that mean there were about 1,500 total cases?
No, I'm sorry, there were about 1,300 total, 275 symptomatic and 1,027 asymptomatic as of this morning.
Okay. And out of 24,000 cases, that's like a 5% rate. Is that correct?
Overall, yes. Mm-hmm.
And in the general population versus the prison population, would you consider that to be high, average, or low?
Our rate has been below the city rate, except for in the very first month. And the reason why it was not in the first month was we were only testing symptomatic patients at that point. So we've been below the city number throughout the pandemic.
And what is the city number currently that you're aware of?
Just one second. As for February, because we don't have, I don't have, partial numbers for March. The city number was 4% and our number was 3%.
Okay. So you're saying 5% right now averages out over time because it was heavily skewed towards the front end of the pandemic. Is that correct?
There were two periods, the front end, and then there was another, I beg your pardon?
So you're currently at 3%?
Yes. Mm-hmm.
Okay.
Well, actually today, the most recent, it looks like about 2%. So March looks good so far.
And how frequently are you testing staff and inmates?
Well, we test the inmates when they come in, and we test them whenever there's someone that shows up that's symptomatic. We'll test everybody that's on that housing unit. And for those people that are that don't test positive, that are on a quarantine unit, we test every 7 days.
Okay. And how about staff?
Staff testing is up to the staff.
So we don't have.
Well, there's no. All of this testing is voluntary. So I actually don't know.
Inmate testing is also voluntary?
Yes. The only two occasions when it wasn't was when there was court-ordered universal testing. Those two times, one in January of this year, and one in May of last year.
Okay.
Otherwise, it's voluntary. And since it's voluntary for officers, we don't know what the percentage is.
Okay. And then is that a department?
Or I should say, I'm sorry, I don't know.
Could you just your background is in the medical field, is that right?
My doctorate is in economics from the Wharton School. I've been a healthcare administrator for many years.
Okay, so you're not a medical doctor.
I am not.
Okay. Is there a medical doctor who's available to talk with us, Commissioner Carney?
We can see if we can get our clinical director on, if Dr. Herdman can do that. Wanted to go back, Dr. Herdman, while you're working to see if we can have our doctor join us. The universal one-time round testing for staff was a court ordered. It was not mandatory. We were doing the screenings for staff and we were identifying staff at that point. The second round of universal testing for the inmates, another court ordered, and we did that. So we are testing inmates, as Dr. Herdman just stated, for those inmates that are asymptomatic, presenting with symptoms or self-reporting. And once we identify a self-report, we're going to test that inmate and we're going to identify whether or not he or she is positive and place them in isolation. We are not doing ongoing testing for the entire population. And we had reported, even though we're reporting the information in aggregate, this information and the numbers have been reported and readily available on the Department of Public Health website, and we did testify to that effect. So I just wanted to put that on the record, that we weren't just continuing to say percentages, but the actual numbers have been available on the city's public health website. And it's under the prison. So we at no time were withholding that information. And it's available.
Okay.
It was always there.
It sometimes helps to have you be able to articulate them as opposed to telling us that, because in the past, when we last spoke, it was an aggregate number and the prisons hadn't been broken out. So in the changeover between the last time that, just being able to know what the numbers are, in part because you know that this hearing is largely about some of that, is helpful and helps us not have to run around and find it for ourselves. It's nice to be able, in part, to have a hearing where, we're not told, go check it on your own on the website, but here are what the latest numbers are. And I appreciate that you brought forward, Mr. Herdman to do that. Yeah. So I wanted just to clarify that. So for, just to follow up before Mr. Herdman comes back with your clinician, we went through this with the school district, and I had a couple more questions, and then, Mr. Chairman, I will absolutely cede to my other colleagues.
Take your time.
Yeah. So, we went through this a lot with the school district of Philadelphia, and I will say that the current commitment around testing, contact tracing was significant, and that the district has agreed to, for example, test all staff on a weekly basis and to test students on a regular basis as well. And they are nowhere near the kind of level of interaction that you currently have with your division. Is the decision not... I also want to make clear that it's my understanding that prisons is one of the areas where you have the most significant amount of overtime. So your staff members may not have a lot of free time per se outside of their work environment to go get a test. It doesn't mean that they're excused from it or can't do it or anything like that. It's just that having on-site testing available can make all the difference in the world between someone getting tested and not getting tested. Is the decision to make staff testing not necessarily available a department decision or a health department decision?
That's our decision at this point. We were considering whether it would be additional testing hereafter. We wanted to do the universal testing to comply with the order. It supported what we had reported with our rates of infection, but it's certainly something that we can consider again. But it's not a total objection to it.
Okay. I just want to underscore, though, that, the school district of Philadelphia, as I said, in order to reopen, one of the commitments had to be on a regular testing and contact tracing commitment. And the next thing, which I want to spend some time on a vaccination commitment, too. So has your staff what percentage of your staff has been vaccinated?
When Dr. Herdman comes on, I believe we're about 15% of the staff. He may correct me, and he's just right back on. Dr. Herdman, the percentage, can you give me the current percentage of staff who have been vaccinated, at least with the first dose?
882 staff as of this morning had received the first dose. That's out of about 2,400 staff, including officers, healthcare, all the staff that work at the prison. And 1,441 inmates have received the first dose.
So a little more than a third.
Yeah.
And is there an intent to be fully vaccinated for your staff? What is the timeline for a 100% staff vaccination?
Well, it's still voluntary. We're offering it Monday through Saturday, I believe, for the staff to receive the vaccine. It is not mandatory as of yet. So we're not taken that into account, that staff are simply refusing. It is available. So we would hope that we would be able to complete the vaccination by July.
By July. Okay.
That's if the staff are receptive to receiving the vaccine.
How many appointments can you take per day?
We can handle anyone that comes in from staff. The inmates are scheduled, so we can control the volume. We should be done offering to the inmates at the end of this month. We can handle the staff at any time that they're ready to be immunized. I should point out that around the country, inmates are more likely to accept vaccination voluntarily than the staff in most jurisdictions. Doesn't make any sense to me, but that is the experience so far.
And have you been working with the union to say like a union day or a labor, your local day can come in and get fully vaccinated on these days?
We do have a schedule, Councilwoman Gim, already in place that's been posted on our closed circuit TV system. We also stood up mass vaccination days to do mass vaccinations at the 4 major sites. We were open, and Dr. Herman, you can give us the hour range, but we had about 20 staff per day that took advantage of the vaccine opportunity. We were sharing the educational pamphlets to the staff and the inmates. So it's readily available in the institutions. Staff simply would just need to present themselves. We already have it in place.
So
the 12 hours a day covering, so we've covered the 3 shifts. Because we are starting to offer the Johnson & Johnson vaccine today, in addition to the Moderna vaccine, we distributed extensive descriptions of the disease and these 2 vaccinations and how they compare to all the inmates and to all of the officers last week. And we started this morning. I'm hoping that more people will agree to be vaccinated because this single dose vaccine is available.
Right. And you feel like your staff is fully aware that they can at any point make an appointment and get a vaccine, I guess, on site? Is that right?
Staff can walk in. They don't even have to have an appointment.
Okay. Yeah, we discontinued the requirement. That was the early implementation because we wanted to be able to control for the numbers and have the appropriate number of doses. So we had initially started with the scheduling. Staff simply just needs to walk in, and they don't have to leave their institution. This is readily available at the 4 major institutions. That information has been shared in informational pamphlets and messaging from me on our closed circuit TV system. It's also read at roll call. Okay. And so the staff uniformed staff are required to stand roll call every day. So that information with the location, where to go, how to get it, we're trying to make it as easily as possible for staff. They don't have to stand in lines. You just need to go to that area of the facility to receive your vaccine.
I want to make room for my other colleagues, and I might have a second round, Mr. Chairman. Thank you very much, Commissioner.
Thank you, Member Gim. Samantha, who's next?
Councilmember Bass.
Councilmember Bass, Chairwoman.
Good afternoon. Thank you, Mr. Chairman. Pulling up my questions right now. One moment. But I do want to, while I'm pulling up my questions, I do want to thank Councilwoman Gim for her line of questioning, which I think was really just relevant and helpful for making sure that the information was out, that we were able to get all of the information out regarding the numbers, because the devil is really in the detail. Having the level of detail is critically important. And so my questions are going to go further into specific details from the information that was provided. Like I said, I didn't have a chance to go over it as thoroughly as I had hoped, but I do have a number of questions that I think will be relevant here. And the first is that in your testimony, you stated that staff and inmates are provided with cloth masks. Can you clarify if all inmates and staff are provided with 3-ply masks or something that's, I guess, what the recommended masks are by the appropriate authorities, the CDC and the like.
Yes. So, Councilwoman, we received your questions on March 3rd, and then we submitted our responses. So the staff, and I believe included in that packet, we are in our third iteration of cloth masks, which is now the 3-ply mask. We've been producing them for the past 4 months, and they are available to staff. We are exchanging those masks. As I stated, if they become unusable or damaged, that the inmates can exchange masks every Wednesday, and staff have access to those masks on a daily basis.
Okay. How closely have you been working? I know that Councilman Gim asked this question earlier. How closely have you been working with the union and union officials to ensure that that the proper protocols are in place and that the workers on site are receiving the proper PPE and that they are in sync with what it is that you all are doing? That everybody is in sync.
So we meet twice a week with the union to discuss issues regarding PPE, staffing, vaccine protocols we're rolling out. So we're meeting twice a week, and we're sharing that with the union leadership.
Be careful standing in those chairs.
Councilwoman Brooks, I think you need to mute. We can hear you. I'm sorry. Hello? Commissioner?
Yes. So
Okay.
I responded, we're meeting with the union twice a week, and we're sharing and discussing information around COVID-19 and our strategies, the vaccine rollout, the protocols, and we're also sharing with them the same information that we're disseminating to staff on our closed circuit TV system.
Okay. Now, since you're meeting with them twice a week, are there any outstanding issues between the union representation and the administration regarding what their requests are, or their concerns are, what the need is? Are there any outstanding issues or requests that you are aware of that you would want to address so that, we can make sure everything is on the table? Because at the end of the day, that's what this is all about. It's really not about pointing fingers or blaming anyone, but really getting down to how do we make sure that we're protecting workers, we're protecting our inmates, we're treating everyone with the level of dignity that they deserve, and that certainly does include the workers and the inmates. So how can you respond to that?
I'm responding that any issue that is presented, we're addressing it in real time. There's not a delay in that information. We're sharing information. We talked about everything from the availability of PPE, hand sanitizer dispensers being available, the masks, the commensurate level of PPE, the lexicon, the plexiglass. We're sharing this information in real time on a biweekly basis. And the reason we established this biweekly meeting is that we could stay on top of any issues and address it. And the last leg of this race was the vaccine. We were very diligent in making sure that we had the vaccine available, not only for the inmate population, but for staff as well. And that's been implemented. And we're hoping that we'll see an increase in staff accepting the vaccine.
Okay, thank you. I don't have any more questions for right now, but Commissioner, I'm assuming you'll be here for the duration of the hearing?
Yes.
Very good. Thank you.
Thank you.
Chairman.
Thank you, Member Bass. Is there anyone else to question this witness?
Yes, Mr. Chairman, could I have a second round?
Yes, you may.
I have questions.
I wasn't sure if Councilmember Brooks was also in queue, so I want to make sure she has it first.
Member Brooks?
Yes, thank you. Commissioner Carney, I have a few questions. Back in December, we discussed the department staffing issues related to staff being out for different COVID-related needs, and that individuals weren't getting out of cell time. Are you still seeing these similar issues with staffing?
Yes, we are. We've been very thoughtful and deliberate in having this discussion with the union, but we are monitoring our staffing levels because, yes, that does impact our ability to comply with the court order.
Okay. And this is a follow-up to Councilmember Gim's question on staff vaccination. Are you guys tracking staff who are getting vaccinated?
Yes, of course. We have to do that because we report this information to Department of Public Health.
Okay. And my final question is we've heard reports that 2 visitation phone calls that are free have been reduced from 15 minutes to 10 minutes, which my colleagues and I discussed in the last hearing back in December, that 15 minutes to speak to family is already dehumanizing as it is. Is it true that there has been a reduction in visitation call time being down from 15 to 10 minutes? What steps is the department taking to ensure everyone receives their legally mandated 15 minutes?
So what we did at the onset of the pandemic when we suspended the in-person civilian visits, we have longstanding provided 10 minutes of free phone time per day to every inmate. That's been a longstanding practice. We simply increased that by 5 minutes to get us to the 15 minutes. So we did announce that to the population well in advance that it would be effective March 1st, that it would revert back from 15 back to the original 10 minutes. However, we extended it by another week. It ran through the week of March 8th through the 12th, where they still were able to get the 15 minutes. That's on the analog phones. But we also provide 2 30-minute, 15-minute virtual visits. And I do have Ms. Deborah Snyder on here. That's my contract administrator to walk us through. So it's not simply that they're down to 10 minutes. They're getting 10 minutes in additional to the free virtual time. Ms. Snyder?
Good afternoon, Councilman Brooks. I'd be happy to give you 5 minutes.
Hold it, please.
Wait a minute, Ms. Snyder.
Commissioner, I know you're in charge up there, but this is my hearing. Can you please state your name for the record and then in your comments?
Thank you, Councilman.
Good afternoon. My name is Deborah Snyder, and I'm the contract administrator for the Department of Prisons. Councilperson Brooks, I'd be happy to answer your questions that you've asked regarding the phone calls and video visitation. As Commissioner stated, phone calls, which is the standard regular analog phone time, has been long-standing and provided even prior to COVID at 10 minutes per day per inmate. On the onset of COVID, at the stoppage of visits person to person, the department allowed and put into place an additional 5 minutes per day for every inmate. So every inmate was able to make up to 15 minutes per day of phone time up until we were able to implement the video visitation program. The video visitation program, which is a face-to-face video program that was started December 15th. That stayed in place. The phone time for the extra 15 minutes stayed in place. It was scheduled to end March 1st. But the vendor gave an extra couple days, and that did not even end till March 8th. So all inmates received 15 minutes per day of phone time. Now, the confusion sometimes is the video time. Video time is 30 minutes of video time, which is per week, per inmate. Every inmate is getting 30 minutes per week. Does that answer your questions?
Yes, thank you.
Anybody else? Thank you.
Are you done, Member Brooks?
Yes, I'm done. Thank you.
Thank you. Okay, Member Gim?
Thank you very much, Mr. Chairman. Okay, I think, so I wanted to go back a little bit to the testing question, in part because if your medical examiner is not currently here, I would like to see if you could just send us back another medical, your department's rationale for not offering, on-spot testing. Again, just underscoring the importance of being able to test your staff. This is specifically around staff testing. And just ask that, there needs to be some understanding of why staff are not being offered testing as a regular part of their job. The second thing I wanted to ask is if you know what the current prisoner to staff member ratio is on a given shift. It's not like aggregate, but in a shift, what is the prisoner to staff ratio currently?
Well, it's dependent on the collective bargaining agreement, where we have a ratio of 1 to 53 and 1 to 64. It depends on the facility where it is, but we could get that information back to you.
And is that actually being executed, or is that, there's been complaints that we've directly received about low staffing levels. And what I'm trying to understand is whether you have, and you mentioned it with Councilmember Brooks, I'm trying to understand whether you have where the problem is.
So without jeopardizing the safety and security of giving numbers out regarding staffing, Councilman Gim, we are looking and have been addressing the issue ongoing pre-pandemic with the union regarding the sick leave usage. And the city has a sick leave benefit that protects the staff from lost wages due to illness or injury. And we want to make sure that we are implementing this benefit appropriately for the full benefit of the workforce. So you have dedicated men and women who are reporting to work daily. But anytime you have an increase in staff leave usage, it is going to negatively impact operations. So we would be happy to have a conversation with you, but we certainly do not want to be in a position to give numbers across the facility, because that can potentially jeopardize the safety and security of our staff that are present. But we've been addressing this issue. We want to make sure that we're properly implementing the city's leave benefit. But we're addressing this, the union, we address this on our biweekly call. This is a standing issue.
Are you able to share with us what the current attendance rate is for staff?
Not at this time in this public forum, again, jeopardizing safety and security, Corrections 101. But
could that be something that you have a conversation with our committee chairman about?
Certainly.
Okay. Back to that similar issue, though, recognizing that may be the case, what do you do in the event of an absence? What is the department's policy to fill that vacancy in your staff? Because, as you said, staff safety is deeply impacted, and staff members cannot be put in dangerous situations. And the complaints that we are getting are from staff members who have been hurt on the job because of low staffing levels. So what is the department's practice if there is a call out? What then happens?
So there is a voluntary sign up where staff can sign up to work overtime voluntarily. If we do not receive that, then we go to our draft protocol, which is a mandatory 4-hour draft, okay, where the staff must work then those 4 hours to cover those areas where there's the inmate population. So there is the ability for them to first volunteer. We can go through that list, and then if we're not able to get the number of volunteers, then we can draft.
And what's the participation amongst the draft?
It can be varied. It depends on how many people are going to stay for that draft. When people are drafted, some will then leave sick. And if that is the case, that further impacts operations.
So I think, Mr. Chairman, what we would want to do, and I'll follow up with you as well and with your team, but I think we want to know a little bit about attendance, and then we want to know what the fulfillment of a vacancy is on any given day. We've dealt with this before in teaching, we've dealt it in other places, but it's clearly a major concern. We have a number of women, in our Department of Corrections. Of course, we have men. It doesn't matter who it is, but we want to maintain it. And I also want to just underscore that some of this is inevitably around some element of morale. I mean, this is also really important for us to be able to, this has been a very, very difficult year for you, Commissioner, and for your team. I think I speak for all of us on the committee when we want to extend our gratitude and our appreciation and our recognition of what your corrections officers have done during an almost unimaginable time. But we are worried about morale amongst staff, and to the extent that we continue to have this conversation with our chair to figure out this a little bit better, I think that's an important aspect of this.
And I agree, Councilwoman, because we do have, hardworking men and women that report daily and they give it their all. And it really is those folks who shoulder, the responsibility to provide coverage even when we're challenged. So I do want to acknowledge that. And the staff have expressed that to me as well, that, Commissioner, we're giving it all that we have. But if we could all report the work, that would help.
My last question is, as you know, one of the major reasons for our concern about full staff complements being present is because our prison population has increased. So it went from 4,200 pre-pandemic. It's now 15% higher at 4,800. That is a very big concern. When was the last time the population was reviewed for early release that you're aware of?
It's been ongoing. Since the onset of the pandemic, we have shared that information with the Defenders Association, the courts, and the district attorney for those inmates that have been identified as vulnerable populations that meet the criteria to be released. We believe we circled through that population mid to early way in the pandemic. Right now, we have about 95% of our population is pretrial, and the remainder being sentenced. So we've continued to share that information.
Can you repeat that? What percent are pretrial?
If about 5% are pretrial. Are sentenced.
So 95% are pretrial.
Yes.
And how many of the 95% of 4,700 would 4,700, 4,724? So that's like 470, 240. So that's like 4,500 of them, roughly, are there pretrial. How many have you recommended for early release?
Early, I would have to get the updated numbers for you. But early on, we had about 2,000 individuals that we submitted on those lists for consideration for early release.
And how many were granted?
I would have to circle back to give you the accurate number.
And when was the last time that list was submitted?
That list is submitted daily. Dr. Herdman, we submit that information through Dr. Herdman that goes through the courts. He's our liaison to share that medical information because the medical staff are vetting that list and identifying the criteria. So if he doesn't chime back in, we'll get you that list. But it's been ongoing weekly.
And who do you feel has the power to determine the early release? If PDP has recommended 50% of the population for early release, who is blocking that? What department would be blocking that? Would that be the courts?
Well, the department that would have the ability to release would be the courts. I'm not saying blocking. I'm just in my response would be they would have to assess.
Or denying, approving. I apologize for my language. Yes.
So that would be a joint effort. You have the courts, the district attorney, and the defenders. Those are the criminal justice partners that play a role in the reduction and the release of folks from custody.
Just a point of clarity, Member Gim, early on in the pandemic, they were meeting daily. Wasn't it daily, Commissioner?
Well, we were meeting daily behind the walls. There were some weekly meetings, Council Member Jones. There were some weekly meetings that we were actively involved in to try to reduce the population.
And if I recall, it resulted in over 1,000, at least, releases.
Yes, it was close to 2,000 in my recollection, where we were getting folks identified and processed out, and we did release quite a few of those folks in the early to mid part of the pandemic.
And if I understood, and I don't mean to interrupt, Member Gim, but to my recollection, in your testimony, one of the reasons why the population is large again is because there's been a stall in actual court hearings over at the courts. And I'm not trying to point fingers, I'm just remembering what you said. Is that a yes or no?
Council member, can you repeat your question?
All right, so if I recall earlier in your testimony, one of the reasons that we are still up at 4,000 census on state roads is because of the slowness in the courts due to COVID.
It's the court proceedings that have to be scheduled. We continue to work with the courts to get those court hearings scheduled. And then you have the other partners that would need to be prepared to present the case or defend the case. And that would be the district attorney or the defenders. But the courts have resumed January 2021, and we're making those individuals available virtually and in person.
And that was why there are longer stays currently, correct?
Correct. The admissions are outpacing the releases at this point.
That's all. All right. Member Jim, I'm sorry.
Yeah, and I'll, I want to finish through, but I want to be respectful of time, so I'll try to be as quickly as I can. The prison population has increased about 15%. Has your staffing increased by 15%?
No, it has not.
Okay. So I think this is what we are talking about in terms of very dangerously, what has been described as being dangerous staffing levels. And just want to underscore again with our commissioner, our committee chairman, that what we would like to follow up with you is concerns that we have grown the prison population by almost 15%. The staffing has not grown concurrently. So we have, serious concerns about safety of prison, of our corrections officers with you, compounded with, worries about sick, people not only being sick, but taking care of other people who are sick. Our numbers are extremely high still. There were 673 cases reported over the weekend alone. I visited the city morgue today and saw plenty of serious concerns about what's happening. The concern is about the growth in the population. If there are 2,000 names on a list, Mr. Chairman, who PDP has recommended for early release, and given the fact that the population is growing, I think we have to figure out another conversation yet again with our courts, and then we have to deal with the safety of our corrections officers right now. I think we should see that as an absolutely urgent issue, given the growth in the population, the lack of movement, and this, and people still getting sick.
Member Gibb, duly noted, and we will take actions to follow up on that.
Thank you so much, Mr. Chairman.
Councilman,
yes.
If I can respond also, that the district attorney and the defenders must petition the courts from those lists that are provided. So it's not strictly on the courts. They have to petition for those folks to be considered to be released, and then the court would decide. And I'm looking forward to that conversation as well regarding the staffing issues as well.
We will absolutely make haste to follow up on that. Member Johnson?
Thank you, Mr. Chair. How you doing, Commissioner? How are you? Hope all is well. Always good to see you. I just had just a small question as a follow-up from the last hearing. I think you answered part of it with Councilmember Kendra Brooks regarding the time that individuals are allowed out of their cells, right? But also, what's the family visitation policy? Has it increased in terms of, during this health pandemic? The telephone situation, can you just give me an update on where we're at in terms of the telephone situation as well?
Yes, so we continue to have our civilian in-person visits suspended, given that we are in the full throes of our vaccination protocols for the city. At the time I submitted the testimony, it was 219,148 virtual civilian visits. Deputy Commissioner Xavier Buford, can you give us the current number as of today?
Yes, Commissioner. Hello, council persons. My name is Xavier Buford, Deputy Commissioner of Administration for the Philadelphia Department of Prisons. As of today, we have completed 237,017 friends and family visits. And just to give you a little more insight, when this program started in December, we did 20,860. In January of 2021, we completed 75,828. In February of 2021, we completed 87,145. And as of today, we completed 53,184 visits, and it's March 15th. So that's just giving you some insight that as the program has ramped up, the usage has ramped up.
Okay. And another question, in terms of staff to prisoner ratio, what does that look like? And has that changed on the health pandemic?
Well, the collective bargaining agreement still is in effect. However, again, as stated just shortly, that if there are leaves of usage, then we're going to have to make sure that the entire population will have to manage how they come out and still align with the collective bargaining agreement ratio. So if it's so many inmates to one officer, that's still in effect, the entire housing unit, however, not out at the same time.
In terms of hiring, what does that process look like? Have you had a hiring freeze?
We have not had a hiring freeze, and I'd like to bring folks' attention back to prior to the pandemic, we had pretty much had a population at 3,500. We did not onboard staff at that time because the population was trending down. We were not in a pandemic, and the people who were enrolled in the drop were at the beginning of their drop. So now that we are into the 4-year mark, this is what we're experiencing. We're experiencing an increase in the population, certainly. We had already accounted for those folks who would drop, but we've had some separation. But what we're doing is we have a cadet class in progress at the training academy. We just did orientations on the, I believe it was the 5th and the 13th of this month. And then we will start the process all over again to identify those applicants who reported, and we'll start to engage to see if they meet the criteria to onboard them. And we will continue our hiring process now that we're in this position. I think the biggest misconception is that just because the population is going down, that you would continue to hire. No, we have approved number of staff for our department. As the population was at 3,500, we were well positioned not to bring on another class. But this is where the great collide happened. You had People at the beginning of drop. No need to hire, population's 3,500. All is well. Then you hit the pandemic. Then you hit that 4-year drop mark. And then you hit some those are the variables that make up where we are right now. We're in the process of hiring additional staff.
Okay, and last question before I wrap up. Can you give me an update on the percentage of employees and correction officers and employees, administration in general, right, who have had COVID? And how is your staff managing that process?
So we've come through, I think, the most challenging time, because when we did the one-time universal testing, it was at 1%. So those staff are back. We've applied every single city statement regarding approved leave, CARES Act leave, EPSL leave. We've had people that have exhausted FML. We have people that are on personal leave of absence, medical leave of absence. We extended those leaves in a systematic way, case-by-case basis, still maintaining the need to have security present inside the facility. So we've extended all of those benefits and opportunities to staff throughout the pandemic. Now that staff has utilized the various leaves, and if you review on a case-by-case basis, still managing the sick leave benefit that the city offers, our goal here is to make sure that people, if they can take off and they need to take off, we're doing that, and still being diligent in managing our staffing levels for the inmates that are in custody that we're still responsible for.
Okay. And is there a strategy to work with the health commissioner and the administration regarding the vaccination of inmates as we go forward? I know they don't qualify for the first two categories, but I know the president said at a certain time period in May, he wants people from 18 on up to be eligible to be vaccinated. So are we pre-thinking a strategy regarding making sure that that population, because I'm pretty sure out of any population who's not receiving advocacy to get vaccinated is probably the prison population across the board. And so can you give me an idea from your perspective how you're managing that on a local level regarding inmates for the future when they can qualify?
They are qualified.
Oh, I'm sorry, Councilman.
Now, it just was point of information. You did testify to the fact that inmates are being vaccinated now, and there would be a greater number of them probably more likely to come forward now that there is a one-shot Johnson option.
And I'm pleased to say from the very beginning, I advocated that we split our doses equally for the inmate population and the staff. That's been from the inception of our vaccination protocol. So the inmates didn't have to wait. What we did was we prioritized the most vulnerable inmates first. So they were day one, inmate most vulnerable, and we worked our way to expand it through the vaccination program. As far as the staff, day one, staff assigned to those areas in isolation, the hospital, or working directly with the intake areas, they were the first staff, and then we expanded it for all staff. So it's been equally distributed from day one for inmates and staff.
Awesome. Thank you. That's all I have. Thank you very much, Commissioner.
Thank you, Member Johnson, for keeping this at the forefront of public safety and health. Are there any others to question Commissioner on this panel? Seeing none, thank you for your testimony and your responses, Commissioner.
Thank you, Council.
Ms. Williams, is there another panel to testify?
Yes, the second panel is Robert Listenby, Pierre Bradford Gray, Sergeant David Robinson, Lieutenant Akira Cease, and Eric Hill.
Can I remind members to put their mics on mute? Thank you. Is the panel ready to testify? Can you hear us?
Yes, Council President.
Hey, Councilman.
All at once. Okay, in which order, Ms. Williams?
I have Robert Listenby listed first.
Would you state your name for the record and please begin your testimony?
Good afternoon. My name is Robert Listenby. I'm First Assistant District Attorney for DA Krasner. I'm here to testify about some of the activities of the District Office.
There's an echo.
To reduce the population in the prisons. Just to start with, President Judge Dugan on the 8th of March began a gun preliminary hearing at the CJC. That gun preliminary hearing, those courts began on the 8th, the 10th, 11th, and the 12th. They were staffed by our gun violence task force and senior staff from within the district attorney's office. For the first 4 days, there were 45 cases heard. 25 of those cases were held for court. 17 were continued, and only one was discharged. President Judge Dugan has announced that he is going to have hold preliminary hearings up at the detention center on State Road, starting on the 29th of this month. The first week, those preliminary hearings are going to go on Monday, Tuesday, and Wednesday, the 29th, 30th, and 31st. The second week, they're going to go on Monday, Wednesday, and Friday. And then the third week, they're going to go all 5 days. In anticipation of the start of the preliminary hearings at the detention center, the district attorney's office has created a virtual witness block for witnesses to testify at the district attorney's office with all the appropriate technology. In addition, we've set up transportation for witnesses, created a security screening process and waiting area for witnesses. We conducted our own internal test today. Tomorrow, we'll welcome all stakeholders to the district attorney's office to observe our space and process. Furthermore, we look forward to hearing from the Defenders Association and the courts regarding who will be observing and swearing in witnesses at the district attorney's office starting on the 29th. So we're going to begin this process in earnest as required and dictated by President Judge Dugan on the 29th, and we hope that this will help to reduce the population at the county jail. We hope that both courts, the guns preliminary hearings and this court, as well as our other serious gun cases being tried in other courtrooms in the CJC will go forward. In addition, we've been working throughout the pandemic in family court, continuously holding hearings. Very pleased to announce that those hearings have resulted in reductions in the population at the Philadelphia Juvenile Justice Services Center. Last week, the number of people being held there was down to about 93. I don't know the population today. I haven't had a chance to check. Also, the out-of-home placement numbers, when DA Krasner began here in January of 2018, there were approximately 600 children held in out-of-home placements, according to family court and the probation department. That number has been reduced by about 80% to about 108 as of 2 weeks ago. So the numbers are down dramatically. Along with reductions come really intensive home processing to make sure that children are in school, to make sure they have opportunities for addressing other kinds of educational opportunities and job opportunities in the community, and other kinds of services to ensure that they are a positive force in the community. I'm open to any questions you may have about what we're doing.
We're going to hold questions until the entire panel gets to testify. But thank you and thank the DA for the work that was done early in the pandemic, along with the Defender's Office, along with the courts, to reduce that population. Those numbers could have been far worse had you not been dedicated to reducing the census on State Road. Who's next?
Thank you,
Ms. Williams.
Here, Bradford Gray.
Good afternoon.
Ms. Gray.
Good afternoon, Councilman Jones and the rest of council members. First of all, I want to thank you for having this hearing, because I think a lot of information is either non-transparent or not available to many of us, even working within the system. So this is really appreciative, not only on behalf of myself, but on behalf of the staff at the Defender Association. Before I just begin in talking about some things, I want to say during the time of crisis, we really saw either leaders emerge or leaders exposed. And in this situation where we're dealing with health and the crisis of people's health, there's a lot of disappointment that we've had in the way things were handled or the way that entities, and I say in particular, the Defender Association has not, in my opinion, been valued as stakeholders that have led this effort. And I do mean led. When we talk about the efforts early on and the petitions filed, the defenders have filed over 6,000 petitions, not only for Defender, on behalf of Defender clients, but on behalf of the private bar as well. We continue to file petitions daily. The population in the jail has shifted. Most of the members in the jail now are pretrial and not sentenced. So when we file motions or petitions, some are denied based on the charges that they are accused of. And now we all know that charges are just that. However, charges are hard to overcome when you don't have more facts about the case. And so we are eager to get cases going. However, we have to be safety first. Our staff has gone in to these courtrooms and litigated motions and advocated on behalf of our clients. But also, one of the things that we have on our plates in terms of being prepared is we have to spend a considerable amount of time in those prisons talking to people. Not only were we using virtual, we're also using in-prison opportunities. And one of the areas that we have been most critically concerned about is while there are processes and policies that are in place, we have often been met with frustration because these policies have not been followed and really have jeopardized the safety of our staff. So when we talk about our staff going in and hearing from our client that they are COVID positive and having to end the interview because of that information, the frustration on behalf of my staff about why would we be put ourselves in these positions time and time again with no guarantee of safety has been constantly questioned. It has been hard for me to increase the morale of my staff, especially knowing that many of the stakeholder groups in our system, judges, probation, sheriffs, prison guards, and not that they shouldn't be, have all been vaccinated because they are essential workers and they work in the same system. However, the Defense Council, particularly the Defender Association, has been left very vulnerable. We have not been classified to be vaccinated, although we go into the prisons, unlike the district attorneys, we go into the courts. We have not been even evaluated to see if we could be classified as an emergency 1B essential attorneys. We have begged, we are working with Vanessa Garrett Harley to get some of our lawyers vaccinated as we're being asked to expand more. And we want to expand more because we work on behalf of the people and we know it's very important and critical for people to get their cases moved. But it should not be this hard to ask for protections from us as all the other stakeholders in this system have been protected. And I think that there's a huge devaluation in the work that we provide, but also the leadership we have shown. We have worked out strategies to reduce the prison population. We have provided 18-page memos with different strategies. We are constantly on calls. We are in working groups. Our staff has the technology, thank you to City Council, to not only get these petitions done expeditiously, but also to figure out what's actually holding people. We have communications with our clients and our clients' families. We work with the communities to get information about what we should be doing. Our juvenile unit has been doing a phenomenal job to decrease their own backlog by providing mitigation reports, not just to the district attorney, but to the courts to figure out who should be held, what cases should be dismissed. And those have been met with a lot of reception. So when we talk about people leading in crisis, please understand the Defender Association has been that. I am not pointing the finger at any other stakeholder. I am just finally sticking up for the members and the staff of the Defender Association who has been working from day one, not only working, but pushing and advancing all other entities in the system. I had to make a tough choice about and the tough choice was I had to stop our participation in jury trials. Why did I have to do that? Because we had information that one of our lawyers who did the first jury trial when we reopened was put in harm's way when there was a potential for a client that exposed that he was that he came into contact with someone who was COVID positive and was allowed to be with her for 3 days. We got information that her client initially got information that her client was positive, and then we just got information correcting that on Friday, which would have been March 12th, letting us know that that information that we received initially was incorrect and that the person was not COVID positive. However, our staff had to quarantine during that whole time, which made her unavailable for other assignments that she was assigned to. And she was assigned to doing high-level shooting cases and gun court cases, and we could not use her for those things. And so the fact that we are still here asking to be vaccinated as essential workers, as an essential part of this team, baffles me that we still cannot get evaluated and looked at as people who are running risk by going into these courts, going into the prisons, going into several different congregate care settings to prepare cases so that cases in the system can move along. My staff has been willing to work. We've all been working. We have created our own activity sheets so that we know what activity is being generated. We have our own accountability mechanisms so that we are good stewards of the city's valuable tax dollars, but we're also making sure that we're working on behalf of our clients in the communities here in Philadelphia. And so I wanted to put that there, and I'm free to answer any questions you have. But at this level, you are getting the frustrated chief defender because we have done everything we can to be good stewards and good partners and good leaders. And we are still left vulnerable when other people and other members of this stakeholder group have been protected. So thank you very much for having this hearing. And honestly, I look forward to any questions you have.
Defender Gray, I know personally how much the Defenders Association, with your leadership, has done to change the paradigm of justice in Philadelphia. So it comes as a shock to me that you and your staff haven't been considered frontline essential personnel, because you're darn sure essential to the dispensing of justice in this city. So what I want to do is I want to take it upon myself personally to ask why that is. And I hope to be able to get an answer sometime tomorrow, because we periodically, leadership of council is meeting with the administration and health department to talk about these kinds of issues. And I will pick up that banner and raise that question in that forum. I want to also say that Thursday is Defenders Day. And that does not, see, I knew that. So I just don't want you to think I didn't. And I want to, better than a resolution, better than a citation would be an answer. And I hope to deliver that by then.
That would mean a lot to the men and women in this office, councilmen, that have been working hard. And everyone talks about how we have reduced the prison and we've done this. The defenders, and only the defenders, have had that heavy lift. We have created all of the petitions. We have generated all of the petitions. And so when people talk about it loosely and don't remember the fact that we are the most devalued in this system, it really burns me up. And I apologize for my, demeanor in this hearing, but just listening to this is really unfortunate because the judges have been vaccinated. Judges are enclosed in plexiglass. We are standing there outside with our clients, with the community, and we cannot get at least the consideration of being vaccinated while we're expected to go in and do more. And we are the only lawyers that go into the prisons.
So I try real hard to under-promise and over-deliver.
I got you.
All right?
Thank you.
Who's next, Ms. Williams? And then we'll open up for questions for the entire panel.
Sergeant David Robinson.
Yes, greetings. Thank you, Mr. Chair, for having me. I'm here to represent the men, the hardest working men in the city of Philadelphia, the correctional staff of State Road. And I just wanted to start off by saying the reason why staffing is low is not just because of COVID or people being scared to work in these jails. It's because when the men and women come to work, they'll do a tour of duty and they don't even get paid for it. It's basically modern day slavery. They don't get paid their wages. Now, as far as COVID, we can talk about that all day. So my thing is, the prison system are recycling masks when it comes to inmate population. When I say recycling, if I have a mask and it's that Wednesday and the mask has to be exchanged, I'm giving that inmate a mask that another inmate had probably 4 or 5 days prior. They're not issued new masks. The staff isn't issued new masks. Now, the last time we had this hearing, Deputy Commissioner Buford said they had thousands of N95 masks, but that's not the case. They might have it, and they might still have the same 1,000, because if an officer has to have the mask that works on a unit where there's over 70 quarantines or positive COVID inmates, they have to make a phone call to the supervisor. That supervisor has to make a phone call to their supervisor just to get a clearance to even call another supervisor to get a mask. It's not ready available for that officer that has to work that area at all. I've donated almost 1,200 masks to State Road and even PJJSC. And the administration is not transparent enough to understand what's going on. People are running away from this job. They're running away from this job because they're scared. They're scared because of the repercussions. The people that come to work are the ones that's suffering. You have people that's on medical leave that's getting fired just for being sick and being threatened. If you don't come back on this date, you won't have a job to come back to. These people are COVID sick and everything else. Not just COVID sick, but real serious medical issues. And these are hard-working men and women that's forgotten in the city of Philadelphia. They've been wanting to keep us quiet for years. We can't fight the city and our administration. Our hands are tied. These men and women are not safe. The locks, we have lock mechanisms, a big issue on State Road. People don't come to work because they're working by themselves every day. Every day. So if I have to be around 64 inmates, I don't even have a rover or escort to watch my back. So when it's time for me to feed, and if this aggressive inmate, he's aggressive because he's been locked in for hours because of staffing levels, now he wants to fight. Now I'm being assaulted. Now I'm going out and I'm not even getting 100% pay. I'll be getting 75% of my pay. So my thing, there's a lot that the administration can do to help these things, but it's like they're not doing it. I'm sorry to say it's not happening at all. Even if they can call in first, second days to come into work if they choose to, but they don't. So the staff is already available. If it's my day off, I might want to come in. If you call me, or if I say, hey, can I come in? There's been a hiring freeze as far as overtime in certain institutions where we can't hire a certain amount of people, but we're not opening up these posts. And people are working short. They're working alone. So yeah, they're scared because now it's a norm for an officer to be assaulted and nothing happens. Absolutely nothing. So I now have to worry about catching COVID because I don't have the proper PPE or having feces thrown in my face. And it's not being addressed. I haven't seen my leadership come around to any roll calls just to say, officers, thank you for coming to work. We're in this fight together. That has not happened. And people talk and they're getting frustrated. 1,000 people, I'm just throwing that number, but a lot of employees have left this job. This is a career job. This isn't just a job. This is a career. People put their kids in college, bought their houses, and paid for their cars with this job. Now it's more so just a job. That's how frustrated it's getting. Nobody's staying. They're even leaving drop money on the table just to get out of here. And I blame the leadership. I blame the leadership because they don't care. And it shows. It shows. that test, that mandatory test that we took one time just because the courts did. We wouldn't have took that test if the courts didn't say so. Or contract tracing. They're not doing proper contract tracing. There's proof. If I can sit in an interview room with a lieutenant and then 2 days later, oh, that person might have tested positive, I'm not getting the call and say, listen, I know you were in an interview. Listen, you might have to self-quarantine. But if I do self-quarantine, if they call me, which they won't, now I'm out because I'm not getting paid for it. I contracted COVID myself in April of last year and wasn't ready to come back. But I was getting a phone call, you have to come back. People are returning to work with still showing symptoms. That's not safe. You can't stop something unless you start somewhere. And my thing, if you're recycling masks, you're washing them over and over and over again, that thread cloud is going down. Trust me. Now it's just you're like having a napkin over your face. That's how unsafe it is. And there's a lot of COVID positive inmates in these facilities. A lot. And when I say a lot, over 70 right now. And they're scooped up one block. And the officer has to work by himself on that unit. Every day. They don't know what they're getting themselves into. I have people call and text me all the time. They're scared. They want to quit. I say, hang in there. It'll get better. They don't believe that. These men and women are forgotten. Nobody talks about the correctional officers on State Road. Even the men and women of PJJSC, the Juvenile Justice Service Center. They don't talk about them either. They're going through the same issues. And it's being ignored by the administration. So is morale down? Yes, morale is down. It's dangerously low. And like I say, it's modern day slavery if you're working and you're not getting paid. And if they find a glitch, oh, we'll see you next check. But then they forget about a debt check. It's the same routine over and over and over again. No answers. And people are getting sick and tired. Sick and tired. If you're working a unit and the locks aren't getting fixed, the locks have been addressed for years, and it's still not being addressed. But the officers are being blamed for it. If you go to your administrator and say, listen, these inmates are popping out so easy, I can show you. I can put a mirror that an inmate buy and swipe it, just like a credit card, and the door open right up. But the officer will get blamed and say, oh, you didn't check the locking mechanism, you're going to get a write-up. But these are the men and women that come to work every day. And now when you get that disciplinary every day, you're not going to come to work because you get sick, because you're getting bullied. And that's an everyday occurrence. It's not safe. The prisons are not safe when you're working alone. Now you got frustrated inmates because they're not getting the time out that they're supposed to get because we're short-staffed. And when that door finally opens, that inmate's not going back in. He wants to fight because his frustration led him to that point. So what is the officer to do? Have to defend himself. But if he defends himself, he or she might get a write-up. It's the same thing over and over again. And I'm asking, I challenge City Council just to come up here and walk, take a tour, just to see how it looks and what's going on. Because the last time City Council came, to be honest, they bypassed the officer, went straight to the inmate, say, how's your day? How's it going? Saying nothing to the officer. And that's why I say we're forgotten and nobody cares.
Well, challenge accepted. We're coming.
Thank you. Thank you.
We coming.
I really think. And you have officers, and I really thank you for that. You have officers on medical leave, like I said, that's getting fired. And they're begging, just give me an extra week. Give me extra month. It's being denied. And they're not ready to come back. What's the good of an employee coming back that's not fully functional and healthy enough to work a unit? Because they know that they're coming to work the unit alone by themselves. But like I said, you have people that's ready to work. If it's my second day off, call me in. I'll come to work. But they're worried about their budget. It's our blood, but their budget. And it's getting worse. and God forbid a Delaware incident happens, that's when the problem will be solved. It's for something tragic to happen. We lost 2 officers, Officer Alex Robinson and Sergeant Price, just recently. 30 years of service. Ask anybody in the mission to even speak at his service. Just to acknowledge his 30 years. Nobody spoke. It didn't happen. It's hurting. It's disheartening. And the people are fed up. But it can be better if the administration is more transparent. It could be much better. Thank you.
Thank you for your testimony. Are there any questions of this panel? Sam?
Councilmember, we have 2 other individuals left on this panel. Do you want to hear their testimony now? Or
Let's continue the testimony.
Okay. Lieutenant Akira Cheeks.
Good afternoon, panel. Can everyone hear me?
Yes.
Good afternoon, really quick. First of all, I'd like to give my sincerest thanks for the panel just giving us the opportunity to, to get our point across and to let everybody know what's also going on inside. Just like Sergeant Robinson said, and also like Ms. Bradford Gray said, it's bigger than just COVID. It's a whole overall thing. Our staff and safety as well, we know we're not valued. It's not that we don't feel we're not valued. On July 26th of 2020, we had a correctional officer that was murdered, coming home from work, in his doorway. No one said absolutely nothing about it. No media coverage. No one came and spoke at his funeral. Nothing. We asked, can we live outside of the city? Because these people who eventually get out, everybody's saying, yeah, let them out, which I'm all for. But where they coming home? We live in these same neighborhoods. So now not only do we have to watch our backs on duty, we have to watch our backs off duty. Also, we had an officer who was stabbed February 2021, just last month, who was forced to come back to work because his reward for his service and being stabbed was receiving 70% of his pay. Because when you're IO, you can't even get 100% of your pay. So now, not only did someone try to take his life, now he has to fight to pay his bills for reporting to work. Where state correctional officers and everyone else, the police, the fire department, has the Lung Act, which will give you the Heart and Lung Act, which will give you 100% IOD if something happened to you. We were denied that. I want to speak on when it comes to COVID with Correctional Sergeant Price, who we just buried Friday. Like Sergeant Robinson said, Sergeant Price had over 30 years in the system. He was a Navy vet. He dedicated his life to the city. He contracted COVID doing the job that he loved. He was 60 years old. Other city departments get to retire at 55. His reward for working past everyone else's retirement age and doing his due diligence was to have the honor guard at his funeral. No mayor, no news coverage. We sit and we watch every day how everyone else is recognized for their service, the police, the fire, city council. Nothing's never said about corrections. The morale is down because every day you have to make a conscious decision of come to work and get assaulted and nothing happens, or don't come to work and get fired. It's beyond me that now, still a year later into this pandemic, we still have staff, inmates, and everybody contracted COVID, and no one has the accurate number. It's insane that if I'm mandated to stay, because as they said, we're drafted, which means you have to work beyond your shift if the staff is short. If I'm working beyond my shift 5 days straight, and on the 6th day I report to work 10 minutes late, I'm getting a write-up for being late for roll call. No thank you for making it here. No thank you for leaving your family and coming here to help us. We're rewarded with discipline. To see your coworker taken out on a stretcher and nothing's being done about it, that's why the morale is down. To have to be forced, we signed up for a service, we know our service. We provide services every day, but we are still human beings. And no one's addressing it. That's the reason why people are not coming to work. But also, we have to take into consideration you hear, oh, people are sick. Well, half the reason why people are losing sick time is because that's the time they're being forced to use. We had a lot of people I know personally who took the vaccine, which nobody's talking about, is the side effects from the vaccine. But a lot of people are getting side effects or getting sick for a few days or whatever. And instead of being considered IOD because you got the shot for your job, you're forced to use your own sick time. So that's why people are out sick. What people don't know is a lot of people, I was lucky enough, by the grace of God, to not have contracted COVID. But as of December 30th, 2020, the 2 weeks COVID time that the staff was allotted expired. The COVID is still going on. So if I was to contract COVID right now, I would be forced to use my own personal sick time. And God forbid, if I don't have any, I'm coming to work because I can't afford to lose my job. So that's really what's going on in the prisons. And I felt as though it needed to be brought to the forefront. We're not trying to point the fingers. We're not trying to blame anybody. We're begging for help. That's all we are asking for help. For the motivation for these people to come to work and provide the service and feel safe. And if God forbid they're not, knowing that someone has their back and have consideration for the job that they do. Thank you.
No, thank you for your service. And
Thank you.
I've been at a number of officer graduations. I didn't know about the funeral, or I would have attended. But let's do something to prevent funerals by giving you proper PPEs and things of that nature. So thank you for that. Who's our last?
Thank you. Mr. Chairman, point of information.
Member Gim?
Mm-hmm. Thank you very much. One thing that I would be curious about is whether the committee could be informed anytime there is an assault on, if we can be made aware of assaults on corrections officer staff, because I don't think that we were made aware of, certainly not, there wasn't a clarity that there was a death as a result of an assault. And I think that's important for this committee to be aware of immediately. As soon as it's been made available to the, to the family and of course immediate members. But it feels not right that we would not have known about that, and that we should be tracking assaults against staff and as soon as they happen.
So agreed, and we need to set up a formal communications with both the prison and the staff so that we can be made aware of these things. And if, not just at graduations, but at those times when they need to know that they're valued at a funeral. I mean, that's important. And sometimes you say thank you by being there. So, all right. If have our last person on this panel to testify, Ms. Williams?
Eric Hill.
Mr. Hill?
Good evening, everyone. For those that aren't familiar with me, my name is Eric Hill, current business agent of District Council 33, Local 159. This is a road that has been traveled over and over again to the point where the road itself is being worn out. I think it's very appalling that a committee such as City Council, one of the highest committees within the city itself, would have to listen to stories of dread from representatives like myself and subordinate representatives, supervisors, and officers within the Philadelphia Department of Prisons, for you to determine at this time that it's a necessity to bring attention to or give attention to the men and women of the Philadelphia Department of Prisons. We all have something in common. All of us on this panel today, we have something in common. Every day you leave your home, you see the same thing. You see a police officer, you see a firefighter, and you see a sheriff deputy. Whether you come in direct contact or indirect contact, these are the three major individuals of employment within the city of Philadelphia that are given the attention that correctional officers are not given. They are considered and named as first responders. They're given attention to the extent where they can go into supermarkets and get discounts, or go to Wawa's or neighborhood stores and be given discounts on food and other groceries, or just a cup of coffee, and be told thank you for your service to the city. As long as there is a black cloud and veil that covers the Philadelphia Department of Prisons, correctional officers of the Philadelphia Department of Prisons will never get the recognition that they deserve. I've been a correctional officer for over 30 years with this city. Some of my mentors have passed, some are still living, but mentoring me into the person I am today, more specifically since 1996, a representative of Local 159, where I wanted to do something to help my coworkers in those dread circumstances that exist then and exist now. As business agent for Local 159, part of my daily routine is spent drafting unfair labor practices against the Philadelphia Department of Prisons. We have a collective bargaining agreement, and we have countless arbitration awards in place that are constantly being violated by the department's administration. This current administration has absolutely no concern for the correctional officers. Case in point, just this Saturday morning, I get a phone call about an officer being stabbed multiple times by an inmate. I have to get into detailed information. I contacted the deputy warden of that facility, and he told me that, well, I'm sorry, Mr. Hill, that it happened, but, what do you want us to do? And I told him, I said, you and the warden need to stand up. Why did you let this happen? Here we have an officer on a housing unit with over 100 inmates, and we have an arbitration award of inmate to staff ratio. At this particular jail, PICC, the staff ratio is 1 officer to every 64 inmates. But because of the inmate federal lawsuit, they're trying to comply with the lawsuit and mandate the correctional officers to let out at least 24 or 30 inmates, even though the total census on the housing unit says 100. That's a violation of that arbitration award. And that's what put that officer's life in jeopardy. He's not the only one. And I said to the deputy warden, what is it going to take for an officer to be taken out on a stretcher with the sheet covering his entire body, including his face? We have officers that are passing out on the housing units because the inmates are using narcotics that get into the atmosphere. It's not COVID, it's the narcotics as well. And those officers are not given the medical attention or recognition that they deserve. As Lieutenant Chiefs and Sergeant Robinson said, once you've exhausted your time, you have no other choice but to be put on without leave pay, without pay, or go on leave without pay. And that's a shame. Why don't correctional officers of the Philadelphia Department of Prisons, why has there not been any legislation by the city council or the mayor's office throughout any contractual negotiations to give what the firefighters and the police officers and the sheriffs have, the Heart and Lung Act? They get 60 days of COVID, whether they contracted or go into quarantine, for as many times as they contracted and as many times as they go into quarantine. And it's paid time, 100% IOD time. If a correctional officer gets hurt or injured, we go out at 75% of our pay. Now, I put the question to you. Can any of you live on 75% of your pay? Or would you live on 75? Would you even take that test to have 75% of your pay given to you as opposed to 100%? To have your health and welfare coverage limited to 14 days? Would you really do that? And we've asked you several times, collectively and individually, take that challenge. Come into the walls that correctional officers go into every single day without the knowledge of if they're going to come out the same way they entered, or if they're going to come out at all, or what time are they going to come out. There's mandates of overtime. In 1979, the 8-hour tour of a correctional officer for overtime was abolished and reduced to 4 hours. Then there was legislation of arbitration enacted in the 80s and the 90s that determined that, yes, you can keep a correctional officer for 4 hours provided, or more for over 4 hours, provided you try to find a relief for them. And that's not happening either. They are recycling correctional officers over and over and over and over again. Another arbitration aspect has been violated since 2018. You all know it because Commissioner Carney is not doing it on her own. She didn't close the House of Correction on her own. She didn't close the cannery on her own. She didn't reduce the inmate population within the detention center on her own. She had to have help to do that. And that help comes from you. It comes from the mayor's office. She didn't do nothing on her own. But you're sitting here looking at us and you're saying, we want to hear your concerns. We want to hear your problems. And yes, we're going to take you up on that. And no one has done anything. But yet and still, these men and women of the Philadelphia Department of Prisons, they don't have a choice like you have to address something when you feel like it. They don't have a choice to go to work when they feel like it, because even when they're sick and downtrodden, they have to push themselves every single day, because if they don't have time, they don't have any money. And if they don't have any money, they can't financially sustain themselves and their family. And it's a damn shame that when before COVID hit the city in March of 2020, I advocated to the commissioner and the other 6 departments that my office represents throughout this city for a contingency plan, and the Philadelphia Department of Prisons was the only pushback, and the response was, unless the officer works in the receiver room or they work on an inmate intake block, it wasn't necessary for personal protection equipment. And when it hit the Philadelphia Department of Prisons like a sledgehammer, it took our people down. It took them down. Some have never recovered. Some were forced out on a Regulation 17 or Regulation 32. And by definition, you all know what that means. So I don't have to go into the details of what 17 and 32 references. And the commissioner says, oh, well, the officers aren't coming to work. Well, here's something for you. Just this past Friday, I was cornered into a meeting of an unknown agenda with the mayor's office and representatives of the mayor's office of labor relations and the commissioner's office. And during that session of that argument, the mayor's office had the nerve to say, well, if correction officers aren't coming to work, then we're going to have to bring people, we may have to bring people in from the outside. Again, all of you know by definition what outsourcing is. You know it's illegal in a workforce where you have public employees that are represented by a bargaining unit such as Local 159, that it is illegal to even think that you're going to union bust, but to say that and think that I'm not going to rebuttal it back or to defend the men and women of the prison system, you're out of your mind. I don't care what the mayor thinks. I don't care what Rich Lazarus thinks. As long as I'm the business agent, I'm going to stand firm and just for our correctional officers. So again, I bring that challenge to you. Stop saying what you're going to do and let's just do it. I'm available anytime you want me to be available. I can change my schedule anytime that's necessary to change. I can postpone things that have been mandated every day of the week for me. If you call me up and say, Mr. Hill, let's go up to the prisons. Don't call Commissioner Carney. Don't give her a chance to correct things or force staff to stay or make things look like they're correct. So when you get there, everything is in place. Catch it off guard. Catch it off guard and put yourself in the uniform of a correctional officer, whether you are a man or a woman. Put yourself into an unrecognized first responder and see how you like it when you're forced to be held against your will at a job that you want to do, that you need to do, that you asked to do, but that job doesn't respect you back. So again, you can have all the questions you want, but until you yourselves start taking action on our behalf, it's going to get worse. And the first time a correctional officer strikes back in any category as it concerns that job, what's going to happen? They're going to be brought up on charges. They're going to be prosecuted. But how much can a person take before it gets to that point? So let's prevent it from getting to that point. Okay? Be the city council that we, the citizens, voted for you and put you in office to be. Be that mouthpiece for the citizens that can't speak for yourself, as I'm the business agent for Local 159 who can speak for themselves, but they speak through me. My day should not be fulfilled and my night should not be burdened with 2, 3, 4 o'clock in the morning doing unfair labor practices and going to Harrisburg or going to Common Pleas Court to defend the officers. But you know what? This is what my pride is to do. This is what I asked the members to vote me into office to do. And this is what I'm going to continue to do for as long as I'm in office. And even when I was out of office, I still made a stride for our staff. And I'm going to continue to do so. One day, this city will recognize the Philadelphia Department of Prisons correctional officers as primary first responders. Because when you take the dread out of the city, when the police start rounding them up, when everybody's captured and everybody's uncuffed, who has to take care of them every single day of their lives, as long as they're mandated to the Philadelphia Department of Prisons? The men and women of the Philadelphia Department of Prisons. That's who. And they need to be respected. And if they're going to be respected, if they're going to be supported, it has to start first from City Council. Thank you.
Thank you for your testimony and the way you fight for your members. And I'm going to be there. And I welcome my fellow committee members on public safety to be there with me. But I'm an independent elected official. I will be there. And I will go through your office to set it up so that it's unpredictable. All right? Fair?
Thank you.
You're welcome. Are there any questions?
Mr. Chairman, this is Councilman Bass. I want to ask that that between you and I, that we coordinate with our labor officials so that we can make sure that anyone who's interested has an opportunity to view firsthand the working conditions.
Agreed.
Councilman Jones?
Yes.
I would also like to respond.
Commissioner,
the invitation.
State your name again.
It's Commissioner Blanche Carney.
All right.
The invitation has been extended. It was extended during the last testimony and is remain extended. I would recommend that you come up on the 3 to 11 shift, unannounced, so you can see. One of the things here, I know there's an election coming up for the union on the 17th, and I believe that I was testifying regarding COVID, and I know there's intermingled with some collective bargaining agreement language. But in the due diligence of the meeting that you will schedule, we will be in a position to present to you the utilization of hard-earned city tax dollars and how we're managing the prisons. We certainly want everyone to be safe. We want staff to feel safe. And there is a level of accountability that is part of making sure that we are taking care of one another. But the most vulnerable constituents that you have are incarcerated Philadelphians that are impacted. And so I just want us to be clear that as we flesh this out, we're talking about operations. We're also talking about an upcoming election, and we're also talking about collective bargaining agreements and, most importantly, utilizing the limited city tax resources that we have most effectively and efficiently. So I ask that that information be at the forefront as we meet as well. Certainly, we acknowledge what folks, a number of things said today were not accurate. And we'll be in a position to present you with that information to support from recycled masks down to locking mechanisms and all the capital projects we have here on State Road.
So, again, this won't be my first time up on State Road. We've been in each and every one of the prisons that were open. And it's the kind of thing where you have to repetitively come back and check on things from time to time. So I look forward to taking that tour again, and look forward to bringing my colleagues with me. I don't miss a graduate. Well, when asked to speak, I always come to the graduations and thank those people who have chosen that form of service. Why? Because sometimes when families fail, when school systems fail, when even religious institutions fail individuals, it is you guys who stand to try to make an attempt to correct people's behavior to keep us all safe. So if nobody else says thank you, I'm saying thank you. And I want to say thank you in a more meaningful way by paying attention. So, are there any questions, members of the committee?
Yes, I had a question, Mr. Chairman.
Member Gim?
Yes. To Mr. Hill and Sergeant Robinson and Lieutenant Cheeks, I'm sorry that we haven't done enough. And if you don't quite feel respected, I want you to know that you are recognized by this body. You are definitely heard by this body, and we will do better to show you that we respect what you testified about. And I will be glad to join my council colleagues on that visit, and to listen a little bit better than we did before. And again, you're our team. So you're our city workers. And, you're the ones going out there. You wear the city badge, and we should do it in a way that makes it feel like it's honorable. And we're just going to have to figure out how to do better. I think it's why I want to make sure that in collaboration with our committee members and our committee chair, we'll try to talk about what's been happening. I do want to know about, it's very serious about the assaults. We take those very seriously. And I'm sorry that we didn't know about the passing of the officer and one of your members. And if we can do better on that, we should, because you should be honored in the way that we recognize other members of the city departments who, are assaulted, hurt, or God forbid, killed in the line of duty. And so, we'll do better on our front on that. And just want to underscore all of this. Now, I guess one of the questions that that I had, and I do have I have a lot of follow-up, but I'm wondering if it might also help with the council chair, whether, at some point there's a union dialogue, a labor dialogue. And as we sit down with the commissioner, we'll try to figure out ways to manage that. But I did want to go back to Mr. Lisenby, actually, and then I might have a few other questions if other council members don't.
Please proceed.
Yep, thank you. So to Mr. Lisenby, one of the, I was glad to hear that the district attorney's office had done away with the practice, had announced doing away with the practice of what's called coercive reslates. So that means requiring juveniles to plead to, like going into placement, residential placement, and then therefore allowing them to go back down into juvenile court. It's our understanding that that's the current DAO's practice. However, we've heard from advocates that is not happening. And so I want to ask you, what is the current practice? Is there a commitment to do that? And if there is a complaint that a juvenile has been involved in a coercive reslate, who do we talk to?
Councilman Gim, the DA announced that there is a practice of sending almost all, but not all children back to the detention center, back to juvenile justice with, conditions attached. There were some cases where the option is to keep them in the adult system or to send them back to the juvenile justice system with some conditions. There are some cases, and the DA actually quoted statistics that said that in a 2-year practice, there have been 6 cases that were kept in the adult system and still some cases sent back to the juvenile justice system. And another year, there were 7 cases. Those were his specific quotes. What I've done to try and address concerns that have been raised by various stakeholders in the juvenile justice community is to review those cases myself. And so as of the last 2 weeks, I've been taking a close look at each and every case that's up to go back to the detention center and go back to juvenile justice to determine whether or not there's a public safety interest in looking and transferring that case back to the juvenile justice system with conditions. There are some extraordinary cases where, and again, I've been practicing the juvenile justice system now for over 30 years. There are some extraordinary cases where under every other circumstance in the past, the case would never have been sent back to the juvenile justice system, or under the old practice, the cases would have been certified to the adult system because of extreme violence involved. In some of those cases, I've authorized the attorneys handling those cases to provide some split decisions where young people are sent back to the juvenile justice system with conditions. Some of the cases involve such extreme violence, shootings, severe injuries, where in order to be able to be in the juvenile justice system, there has to be a condition. So I've just had to look at that from the point of view of public safety, and under extreme circumstances, authorize that. And in terms of who's authorizing it, those cases are coming to me to review. And I sit down and go over not only the case itself and the injuries caused to the victims that are involved, but also look at mental health, behavioral health evaluations to determine what the prospect for the juvenile being rehabilitated in the juvenile justice system are, and what kinds of things and steps ought to be taken for rehabilitation. Because based upon my 30 years of experience in the juvenile justice system, I have a pretty good eye as to what's needed in order for them to be rehabilitated.
So, Mr. Listenby, you just said that the district attorney's office issued a statement stating that there would be no coercive reslates, but then you said that there are cases where you have approved coercive reslates.
I've said that district attorney stated that there were some limited number of cases where, because of public safety concerns, that there had to be conditions. But the overwhelming majority, and I think he even quoted a statistic at that point in time, of cases had gone back without conditions. But the choice, Councilwoman, is whether they're going to stay in the adult system. And the DA actually quoted statistics saying that there were a limited number of cases in 2019 and 2020. I'm sorry, 2018, 2019, where young people had remained in the adult system. For the most part, Councilwoman, those are cases involving homicides or attempted murders. And, in some of those cases, even the decisions being made to try and send them back to the juvenile justice system with some conditions. Otherwise, they would have to stay in the adult system. So I'm trying to say, basically, the DA has not issued an absolute order or an absolute directive. He's issued guidance and direction to me and also to the juvenile staff. And because it's of such great concern to him, I've stepped in to review those cases myself.
What's the district attorney's position on direct file?
The district attorney's position has been, since he ran for office, that he would prefer that all children, to the extent possible, have their cases handled in the juvenile justice system. However, Councilwoman, there are some cases that are not direct file. Some of those cases,
I understand that.
Some of those cases are homicide cases. A homicide is not a direct file case. And some cases are attempted murder cases that are direct file cases, but where because of the age of the defendant at the time of the incident, there's very little time left for rehabilitation. The DA has to constantly balance those cases against the public safety in the community, especially at a time of significant violence in the community where so many young people are shooting one another. I
understand that. I think the issue really is that, there's a clear movement that Pennsylvania needs to end direct file, and that the district attorney should be a supporter of that. But that there are clearly cases where you can absolutely petition to move a case into adult court. It seems, out of the ordinary to have to remove so many young people as a matter of practice. Our preference is that in the extraordinary circumstances in which a young person poses that significant of a danger, the district attorney should make the case to the court to petition that young person up into adult court, and that would be under consideration by the court. But the current practice is that under particular situations, and a significant and pretty wide number of situations, a young person can be sent to adult prison here in the state of Pennsylvania for as young as age 10. And what we need to do is really change that. So I'm trying to get clarity and just recognize that there's a lot of confusion, because I think the district attorney did make a good statement that we are trying to move to end coercive reslates, to keep young people in the juvenile system, except, recognizing that there might be extraordinary circumstances. But there is some confusion because even just hearing you talk about it, it's not clear what those cases are. So my last question was, if there are questions about this, who do we talk to in your office? Is it you?
All the questions can be sent to me. And Councilwoman, I would say, I've not only supported the use of adolescent development throughout this nation as one of the cardinal rules and cardinal principles for evaluating young people. I've not only supported understanding trauma and trauma-informed care for children who've been exposed to violence and who are engaged in violence. I've done that from one end of this country to another in multiple states and written about it in various task forces, including the Attorney General's task force.
I understand. Mr. Lissamy, I'm not disparaging any of your credentials. My comment was about a press release and a directive from the DAO's office and your acknowledgement that there have been other cases that don't mesh with that DAO press release. So this has nothing to do with your credentials. We respect the significant, expertise that you bring in. I know you have federal experience on this. We have worked together. It's why you are part of my youth residential placement task force. I was just trying to get clarity, and I do appreciate the response. To Sergeant Robinson, because you brought up JJSC, do you know whether the population has increased at JJSC? You and I probably shared the same horrors, and I'm not sure if all of my committee members are aware of the horrors that was recently released about the Delaware County juvenile facility. And we will absolutely, yet again, follow up with the state DHS, which we believe to be ultimately responsible. But that being said, are you aware of whether population numbers have also been on the rise within JJSC? As we have heard from Commissioner Carney, that the prison expansion has grown by about 15% since the beginning of the pandemic.
No, not to my knowledge. It's been the same. It wasn't on the rise. It's been the same.
Okay, I appreciate that. We're continuing to track it, and I do appreciate your mentioning JJSC and the importance of us paying attention to the conditions that are there. These are young people, and I really do want to just underscore how much I appreciate your notice that the corrections officers are there, and so we need to be paying attention to that. So thank you.
Thank you.
Yes, and I just want to thank Mr. Chairman. Those are all my questions for right now.
Thank you, member. Are there any other questions for this panel?
Can I say one thing? This is Sergeant Robinson. Can I say one thing?
Yes, please do.
Just to answer what Commissioner Carney said, she suggested that you come to make a tour on 3 to 11. And that's because that's the shift that the most people are on. Last year, there was a shift change that she implemented to where as though she took 7 to 3 officers and forced them to 3 to 11. So now 7 to 3 is working with a skeleton crew. So most of the officers are on 3 to 11. I want you to choose what time you come up. I don't want nobody to dictate what time you come up. I would like for you to choose your time. But I just want to let you know, 7 to 3 is working with a skeleton crew. That's all across State Road, especially at CFCF. 3 to 11 is the bulk. And I don't know what an election has to do with any of this, but please choose wisely. That's all I have to say.
Listen.
Council,
wait a minute. Hold it.
Okay.
Hold it.
Okay.
Commissioner, Chair recognizes Commissioner Carney.
Thank you. The reason I recommended 3 to 11 because you will see that is an under-attended shift. But if we're going to be fully transparent, I challenge you, and I've done it myself, and you can break it up. You can come on 7 to 3, 3 to 11, or 11 to 7. That's where you'll get the full operations and scope of the operations. It was in no way to cite, but I really chose and recommended that so you could see the increased leave usage on that shift. And as we will meet, we'll present the information. Again, reiterating, I believe this to be about COVID-19. I do believe this is a concerted effort. There is an election on the 17th, and to get all these collective bargaining issues on the table, for which there's a process in place and there's a grievance process in place. And so if we're being fully transparent, That is on the 17th. There was a number of issues commingled with COVID-19, and then hopefully we're coming back to COVID-19. We're certainly in a position to show you how the city's hard-earned tax dollars are utilized. I do commend the hard-working men and women that do stand in the gap and have worked tirelessly to fill those vacancies. But I encourage you to come up on all 3 shifts.
So we're going to, knowing my members, we're going to figure it out. And we're going to pop up when we pop up and maybe double back and pop up again. But the key of it is that we want to let all of you know, from the commissioner to the rank and file to the inmates, that you're not forgotten. And we didn't forget about it in the beginning of COVID. That was one of the hearings and issues we raised right at the height of the pandemic. And we're going to continue now that we're coming out the other side. What COVID did was just underscore things that need that kind of attention because they don't have the type of resources that are needed. That's all it did. And so we're going to get through this together, and we're going to figure it out together. And I understand the passion that people have, particularly when they're representing their membership. I represent zealously my constituents. So I get it. But the key of it is, like he said, is let's go and take a deeper dive and figure out what needs to happen next. That's what I want to do. All right?
This is Agent Hill. Can I raise a point of interest, please?
Agent Hill, go ahead, please.
Thank you very much. I have no idea what the significance that Commissioner Carney keeps repeating in reference to March 17th. Yes, that is a date of the local 159 executive office and shop stewards elections. It has no significance in this matter. The issues that are being raised today, again, to this council's attention, are issues that have been raised before last year, at the latter part of last year. These are the same issues that I have raised, and my delegates and shop stewards and executive board have raised periodically since the onset as early as 2018. So there is no significance to March 17th, in my opinion, and it's just my opinion. Okay, I'm not putting words in anyone's mouth, but unless Commissioner Carney is making continuous reference to March 17th because she may have preferential candidates that she wishes to win office so that she can dictate as puppets of the union, I don't see any relation to that.
All right, here's what we're going to do. We're going to go ding, 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 and time out. And we're just going to go get the facts. And we're going to go see what we can do to make it better for everyone that work and live and reside at that facility. That's what we're going to do.
I understand. But she's still trying to impose her will as commissioner. This is a union-related issue. We brought this to your attention. No one came looking for us. We brought it to your attention. And she's purposely trying to put her foot in the door to keep it from closing on her because she's trying to, again, dictate how you circumvent yourself through the prison system on behalf of the union.
All right. We duly noted on the record, and we're going to move forward, and we're going to be up there. And that you have my word. So,
Mr. Chairman, this is Councilman. Can I just make one quick point? And I know Lieutenant Cheeks has a comment too, but I think we also talked a little bit about trying to have a meeting with some of the members more directly, and sure. Maybe that can also, we can hear out a little bit more fully. And I know, it's a hearing. It's we're almost 3 hours in. We really appreciate your time. But it feels like we need to have one that's a little bit more, where more of your members can let us know, be better informed, and hear some of the specifics. And I want you to know that my main concern is after one of your members is stabbed and seriously injured, and others, we have to kick into action. Like, this is not acceptable. So we have to understand this is about the safety of your members. That's why we have, this is an urgent issue. That's why we're here. That's why we're listening. And we have to do better. And, I don't actually know anything about any election. So whether or not anything is happening, my interest is after a severe assault, an injury on one of our own people, on our city workforce, we have to all pull together. And this is extremely important for the safety of the officers, for the safety of the inmates, and for the reputation of PDP.
Well said, Member Gim. Well said. Are there any other questions for this panel?
Hi.
Mr. Chairman, if I recognize.
And is that
I think Lieutenant Cheeks had a comment, and then Mr. Listenby.
Okay.
Thank you. First of all, again, I'd just like to thank everybody for their time, for listening to our concerns. But I also extend the invitation to not only visit the PDP camps, if you can, please visit the PJJSC staff as well, because their assault is up as well, and they're not even allowed to carry pepper spray. So they're another secret that no one really knows anything about. And these issues were brought up again because this is a public safety hearing of what we heard. And I don't feel as though it should just be about COVID. If we're going to address safety, safety shouldn't be dissected. It should be as safety as a whole. And that's the reason why it was brought up. So again, it's not just us, it's PJSC, it's DHS, it's everybody that falls under the umbrella of the local 159. We all have the same concerns. That's all I wanted to say. Thank you again for your time, and thank you for your concern.
Thank you. Who else did we have, Sam?
Mr. Chairman?
Yes.
Yes, sir. I just want to note that if you and council could help speed up the process for vaccinations for assistant district attorneys as well, you have the process of really opening up the entire criminal justice system in a matter of weeks. That would speed up processing of cases on State Road. I believe would dramatically increase the number of people who can actually get out of prison. So I'm hoping that we can get that done. Our ADAs are standing by, ready to go, and as are, I believe, defense counsel across the system.
Yes, so we're going to raise that.
Mr. Chairman, point of information.
I apologize, Jones.
Yes.
Can I also say we defenders had to unfortunately stop jury trials at this time because of the lack of vaccinations. We don't want to stop anything else in the courts, but it's getting harder and harder to go into these courts being one of the only stakeholders, aside from the district attorneys, who are not vaccinated. So as soon as we can get that, we will be back full-fledged.
I should have an answer to that before Thursday.
Mr. Chairman, point of information. This is
Yes.
Councilman Bass.
Member Bass?
Thank you. So we just, I had to drop off of this call for another call explicitly regarding vaccines and the access to vaccines. And I do think that we are going to be able to do something in short order. I don't want to make any promises while we're still working things out. It was a phone call just a few minutes ago, but I do think that we're going to be able, we're going to be in a very good position to address this issue. So, Mr. Chairman, I'll call you as soon as this is over, and we'll try to figure out how to work this through.
Thank you, co-chair.
You've been doing the heavy lifting. Thank you.
Oh, yeah, well, we're in this together.
Yes, thank you. Thank you, Mr. Chairman.
You're welcome, Member Bass. Are there any other questions for this panel? Hearing none. So this concludes the joint hearing of public safety.
Councilman, there are more witnesses left for the hearing.
Ms. Williams, will you please call the next panel to testify?
Claire Shubik-Richards and Dr. Jill McCorkle.
Are there any others beyond them?
Yes, there are. Would you like me to call them up now as well?
How many more are there?
There are in total 4 more witnesses.
Yeah, we can call them all at once then.
Okay. Claire Shubik-Richards, Dr. Jill McCorkle, Janaya Pulliam, and Rachel Santiago.
And thank you all for your patience. And who's first, Sam?
Claire Shubik-Richards.
Ms. Richards, thank you for your patience, and state your name for the record, and please begin your testimony.
Good evening.
Good evening.
My name is Claire Shubik Richards, and I'm the Executive Director of the Pennsylvania Prison Society. So I will, it's been well established in the last 2.5 hours, or however long this has been, that working at State Road during the pandemic is god awful right now, and that being incarcerated at State Road during the pandemic is god awful. So that's been established. I'm going to put a slight fine point on that, and then I'm going to move to solutions. So the fine point on it is assaults on staff at State Road are up 44% from last year, and suicides at State Road are double what they were last year. So that's the data to back up what we've been hearing anecdotally. So now let me just quickly move to solutions. The population at State Road, part of why the conditions are so god-awful, is having over 4,000 people in congregate care settings during a pandemic. The population at State Road is up 2% over what it was on March 13th of last year. And I want to put that in comparison to jails around the Commonwealth. Allegheny County is currently 28% below where they were at the start of the pandemic. Montgomery County is currently 32% below where they were at the start of the pandemic. Luzerne County is 37% below where they were at the start of the pandemic. And if you want to see more counties, you are welcome to go to the Prison Society website, prisonsociety.org, where we have all the counties that were able to provide us data, and also all the information on what the rate of infection has been in all the different county jails and what the fatalities have been at all the county jails. I say this because the number one thing that will keep incarcerated people safe and staff safe and Philadelphia safe is reducing that population. It is doable. Other counties have done it, operating in the same criminal procedure as Philadelphia. So what can City Council do to help get the population down? First of all, Keir Bradford Gray and Bob Listenby are absolutely right. Vaccinating their staffs will get the courts open and will get the population down. But these other counties, Luzerne, Allegheny, Montgomery, have kept the population significantly down, dropped it significantly without vaccinating their staff. So what's different? There has been pressure on the criminal justice actors in those counties to keep the population low, and those criminal justice actors have found a way to work together and get it down. I believe in Philadelphia exceptionalism. So I believe that Philadelphia can do better than everyone else. And someone somewhere will say to you, well, we've been working on the Safety and Justice Challenge. We reduced the population so much before the pandemic, it would be impossible to reduce it that much during the pandemic. I will tell you that Allegheny County was reducing their population as significantly as Philadelphia before the pandemic, and they're currently down 28% from where they were when the pandemic started. It's doable. Okay, what else can be done? We talked about the danger that staff feel going to work. We've talked about the suicide rates at the prison. With the current staffing levels that are achievable at the prison, with the current absenteeism that the prison is experiencing, the Philadelphia prisons is unable to comply with the current court order requiring 3 hours of out-of-cell time every day. The Prison Society has received about 100 calls, letters, and we've gone up to State Road and done about 34 interviews since the last council hearing, actually since January 1st. That, combined with the latest public status filing in the lawsuit against the Philadelphia prison for its conditions during COVID, allows me to tell you the following. In the last month, 8 housing units have reported not getting any out-of-cell time, and 23 housing units have reported not getting out-of-cell time commensurate with what the court is ordering. Why is that? There simply are not enough staff showing up for work, whether justified or not, to actually safely allow for people to get the out-of-cell time that the court is ordering. That is minimal for attaining any sense of mental health. So how can the city solve that issue? I am not going to get into the complications of labor law and negotiations. I know nothing about it. But I want to say that this is not unique to the city. Absenteeism, low staffing rates at jails around the Commonwealth and at the Department of Corrections are common. Whether it's justified or not, almost every facility in the Commonwealth is experiencing dramatic staffing shortages that are leaving conditions to be unsafe. I would encourage this body to think about what the state legislature has done. In December, the state legislature approved an emergency $176,000 appropriation for the PA DOC to bring in temporary staff, trained correctional officers employed with the GEO Group. Now, I don't like the GEO Group, and I'm not saying you want to privatize prisons or outsource correctional officers. It's important that correctional officers are public employees. This is a public duty. But we're in an emergency where correctional officers don't feel safe and incarcerated people don't feel safe because there's not appropriate staffing. And I want to applaud the state legislature for bringing in temporary staff and spending the money that's needed to make DOC facilities safe. And I would encourage this body to consider something similar. 2 other ways to make the facilities at State Road appropriately staffed and safe. And that would be regular rapid testing of staff, weekly rapid testing of staff, so you know who's sick and who's not, and who's sick, even if they don't know it, don't have to go to work. I think Councilwoman Gim framed that issue more succinctly and clearly than I can. And then the next is vaccinations. And I want to applaud Philadelphia. Again, Philadelphia exceptionalism. Philadelphia is the only county in the Commonwealth that has prioritized vaccinating staff and incarcerated people in 1B. And if I was in city council in that room, I would now ask for everybody to stand and applaud, because that is so important and so great. And what is troubling is the acceptance rate. So we know that incarcerated people are only accepting the vaccine at about 50%. We know that the prison is now working to improve the information it's providing to incarcerated people to increase the vaccine acceptance rate. The public information that they provided earlier on was certainly lacking. Staff vaccination acceptance, we are led to understand, is below 50%, lower than incarcerated people. This is consistent with what we're seeing across the state. I recently read a report from Cambria County that only about a third of staff there accepted the vaccine. So the other thing that this body can do is really work to encourage uptake of the vaccine among staff. I'm going to end with just one point for City Council to consider. I know that you came to this hearing after a hearing on the emergency of gun violence in the city of Philadelphia. And I would just ask that whatever you are advocating for to address that public health emergency and crisis, you make it contingent on not increasing the number of people who are incarcerated in our county facilities. That you not have whatever your response is to that public health crisis put an even greater strain on this public health crisis. Please do not make the mistake of your predecessors in the 80s and 90s of responding to the epidemic of gun violence by creating another epidemic of over-incarceration. Thank you very much for this opportunity.
Thank you so much for your testimony, and a lot of that information is very insightful, particularly the comparisons to the other counties. So thank you so much. I appreciate that. Can you forward that to Samantha? Can you put your email in the chat? Or you said it was on your website, correct?
Yeah, I have Samantha's email, and I'm happy to forward our link to Samantha.
Thank you so much. Sam, who's next?
Dr. Jill McCorkle.
Doctor, thank you for your patience. Please state your name for the record and begin your testimony.
Good afternoon, everyone. I'm Jill McCorkle, and I'm professor of sociology and criminology at Villanova University. I'm also the founder and the executive director of the Philadelphia Justice Project for Women and Girls. I'd like to thank City Council for making time today to review current conditions on State Road, especially following the hearings in December. I will keep my remarks brief. I just want to reinforce a lot of what's been said here today, and I want to address specifically one of the questions that Councilwoman Bass raised with respect to our staff and incarcerated people safe from COVID-19. And unfortunately, as we know from the testimony today, the answer continues to be no. While the PDP has made progress, the city's jail system is nowhere where it needs to be to say with confidence that people are protected from COVID-19. There's a number of reasons for this. I just want to hit on three to reinforce other people's testimony. First, with respect to vaccines, I also, with Claire, applaud our city for getting vaccines into the city jail system, particularly in contrast to other jurisdictions who are not doing that. We have to accelerate the pace of those vaccinations. Otherwise, it's going to be a number of months before everyone on State Road is fully vaccinated. Compounding matters, it has been unclear up until today's testimony where the department is in terms of educating staff and incarcerated people about the virus and about the vaccines. As we know from other jurisdictions, overcoming vaccine hesitancy is just as important as actually acquiring the shots. Given the history, particularly in this city, of medical experimentation on people of color and on incarcerated people, it is essential that we provide detailed information in clear and easily understandable formats about vaccines. Second thing I want to hit on is PPE, cleaning supplies, and quarantine. PDP has to continue to strive to do better with respect to supplying PPE, as well as implementing more frequent universal testing protocols that aren't just court ordered, and more rigorous quarantine standards. It appears that there's been some progress on the PPE front, but as we've heard today, there's been recycling of masks. I continue to receive reports on a regular basis from women describing mask shortages, as well as a lack of adequate cleaning and laundry supplies. I also continue to get reports about staff and incarcerated people not properly wearing their masks or not wearing masks at all. And for women who are in dormitory-style housing, there's a mask challenge when you're sleeping. You're sleeping a few feet away from other people. How do you keep your mask on all night? I've also received ongoing reports about quarantine issues and reports about neglect from Horizon staff, cross-contamination issues with respect to placing people into quarantine with positive people, and some of those people who are placed in the quarantine unit have not themselves been tested. And then finally, the last issue that I want to touch on is the physical structures that we're using to house women on State Road. Since August, women were moved into ASD and Mod 3. The conditions in those buildings are a direct threat to women's health and safety. We have received ongoing reports of insect and rodent infestation, decay, rust, mold and mildew, exposed wiring, inadequate ventilation, and units that are not properly weatherized. In Mod 3, women have been forced to get their cooking water from a slop sink in a janitor's closet. Because of the layout of the facility, women have no privacy from staff members when they are using the toilet. And in ASD, there are 40 to 50 women who are sharing just 3 sinks, and those sinks are used to wash their hair, to brush their teeth, to do the dishes, and apparently, at least in one space, to scrub a dog that lives on the unit. These are inhumane conditions of confinement. No one should be housed in facilities that are as physically degraded as these appear to be. In my remarks in December, I emphasized that isolation and the lack of programming would lead to significant mental health crises, something that was shared by staff members who testified both in December and again today about the upticks in violence, as well as an uptick in the number of suicides and attempted suicides. We know that recreation, programming, and visitation are critical safeguards to mental health. And so I'm pleased to see the introduction of tablets so that women and men can visit with their children and their family members, as well as increases in out-of-cell time. That being said, we still have a way to go. And so I urge PDP to continue to move in this direction, extending out-of-cell time, bringing back rehabilitative and educational programming. And I'll just conclude my remarks by refocusing City Council's attention on the need to decarcerate. The biggest problem that we're confronted with right now is that no one's getting out. After an initial drop in the population, we've seen it ticking back up to pre-pandemic levels. Wrong direction. In October 2020, the National Academy of Sciences, Engineering, and Medicine released their report on the COVID crisis in corrections and made it clear that the only way forward is decarceration. We're not going to make substantial progress on any of the issues involving vaccinations, mental health and rehabilitative programming, degraded housing structures, if we don't commit right now to wide-scale decarceration. Thank you so much for your time. I appreciate this opportunity to update City Council.
Thank you. And can you forward those specific housing violations or concerns in the prison to Samantha?
Absolutely.
So that we take our tour. And if you'd like to join us, feel free. You'd know exactly where things are.
Hey, if you put me on that vaccine list, I'm with you.
All right. And go Wildcats.
Thank you.
Who's next, Miss Williams?
Shania Pulliam.
Hello.
Hello. Good afternoon. Good evening, actually.
Good day, all to whom can hear my voice. Thank you for having me.
Yeah, we can hear you. State your name for the record and please begin your testimony.
Yes, my name is Shania Pulliam. I'm a civilian. I have the mind of a philosopher, the heart of a poet, and the spirit of a warrior and a mother of many. I am much more than inmate 854587. Today, I present factual data as a direct result of being in the custody of the PDP due to a probation detainer. I am firsthand speaking regarding PDP pandemic agreement compliance during the custody dates of January 16, 2020 through January 28th of 2021. Philadelphia Department of Prisons does not effectively maintain nor sustain its contract with the city of Philadelphia. Inmates are subjected to decaying, corrosive, and decrepit housing, i.e. DC, Mod 3, and ASD. Neglect of insufficient health care via Horizon Health Services, mismanagement of funding, budgeting, social services, security, and reentry programs. I spoke directly with Commissioner Carney and the Deputy Commissioner Clark during a visit in the tour regarding overcrowding due to the surpassing of a 40 bunk capacity at ASD. Adjustments made compromised classification, however. Mandated extended shifts of officers, whether voluntary or not, resulted in inmates being subjected to fluctuating temperaments that are typically hostile. I recall an officer with a confirmed COVID result returning after quarantine displaying labored breathing. PDP pandemic agreement compliance propaganda. Elusive social distancing, overcrowding of dormitories, and inadequate provision of all sanitation and laundry supplies. biased recreational allotments took place during housing throughout the PDP. From RCF cell G52, I witnessed Gavon Harris removed from RCF cell G53 late March of 2020 by Lieutenant Bolton, during which time I too began to experience flu-like symptoms I believe to have been COVID related. Harris's death in custody of PDP was in fact COVID related. Malpractice of Horizon Health Services, cross-contamination of inmates, lab tests, COVID tests, specimens, and evaluation venues, inefficient lab results, documentation of results, communications, evaluations, and medications, delay or hindering external referrals to specialists, i.e. obstetrics, cardiology, neurology, and radiology. In contrast to other local counties, PDP lacks access to virtual programming, therapeutic recreations, drug and alcohol supports, art and music therapy. Wi-Fi access is available, though unreliable. Access to tablets are for virtual visits only. To drastically reduce inmate population, we need to end cash bail now. Release all nonviolent detainees and detainers. 50% of the current PDP detainees are being held on detainers, preventing bailout. Please note this summary does not limit to what is being spoken here, mere a categorization of much broader spectrum. In addition to customs of the PDP, adult parole and probation, as well as the Commonwealth Court's conduct needs to be reevaluated, investigated, regulated, appropriated, and even more so reorchestrated. Inmates who get COVID are housed at DC cell blocks for 2 weeks to a month because of overcrowding and MI3 and ASD. There are 4 showers to 60 inmates. Conditions there are generally concerning. The environment itself is concerning. It's depressing, the decay, the bars, the flying roaches, the mice, the mold, the poor air quality. We were moved from RCF to ASD on August 12th of 2020. I was one of 3 inmates who physically helped move the inmates. Security was of no help. There were no movers to assist us, and we used a sheriff's van loaded with seats. The CEOs refused to help us except one particular male officer, Johnson. There's 40 to 50 women with only 6 showers and 7 toilets in ASD. When I spoke to Major Lacombe when he was creating social distancing in the sinks, he told me that his orders were a direct result of those whom he answered to when he reduced the sinks on C unit of ASD from 6 to 4. Limiting our access to areas to actually wash our hands, our dishes, cook our food, and so forth and so on. The men had really bad outbreaks in contrast to the women. The standard test was just a temperature check. Hearings were delayed due to poor communication between the courts and PDP when we were placed on shutdown. Private attorneys were not notified, which was a direct result in 2 of my personal hearings being reduced. Virtual courts are only 2 days a week on Tuesdays and Thursdays for the entire population. Feel free to ask me any questions at this time in regards to my direct life inside. Thank you.
Thank you for that detailed account. And so when were you released?
January 28th, 2021 of this year.
Okay. And which facility were you in?
Originally, I was housed at RCF, and then I assisted with moving 140 women and all of their belongings to ASD and MI3 on August 12th of 2020.
All right. Hold on. Do we have one other to testify, Ms. Williams?
Yes.
And who is that?
Rachel Santiago.
Ms. Santiago, are you there?
Yes, I'm here, Councilman.
Mr.
Good evening.
Mr. Chairman, before Ms. Santiago speaks, Could I just ask that the previous testifier and Ms. Santiago, if she has it, if they could just submit their testimony to you in writing so we can just follow through on it.
Okay, I think that's a reasonable request. All right, Ms. Santiago, are you ready to go?
Yes, I am.
State your name, record, and complete your testimony.
My name is Rachel Santiago. I am the lead organizer with Dignity Act Now Collective, as well as the head of Healing and Trauma, as well as the co-founder for Dignity Act Now Collective. I am also on one of the creation of policy for trauma-informed care to implement trauma-informed care practices within the prison system, not just the correctional officer and all staff, but also inmates to have therapeutic support as well. Also a former impact woman myself, and was back in 2018 released from RCF. I have here, my testimony is not just my testimony. These are letters of correspondence from individuals within the housing unit that is now currently State Road. I will start to read 2 letters and close out for you, sir. Here is the first letter. In January, I was transported to CFCF. This is a male on a probation violation. I was placed in a 6-foot by 12-foot cell with 8 others. The cells were only swept out, not disinfected, no mask, no social distancing. Then I was placed into a cell with a man named John for 16 days, and we were denied showers and phone calls for 3 days. At no time were we provided with cleaning supplies. We were given a bed sheet and told use that for our toilet paper because they had none to give us. When I arrived, I was not provided with a care package with a toothbrush, toothpaste, soap, blanket, and comb. I wasn't afforded the opportunity to brush my teeth for 14 days until I was able to buy a toothbrush and toothpaste from commissary. It took me 9 days to get a free bar of soap, which I rinsed my mouth out with because my mouth was that filthy. It took 37 days to get a blanket, and it was dirty. I was denied my medication for 41 days until I was seen by a new doctor and put back on my medication. I was then sent to a multi-purpose room which housed 4 people at one time. In 18 days, I had 6 new cellmates. There were times where we stayed locked in 4 days straight, no showers, no phone. One person was taken off the block because they said he tested positive for COVID-19. I fear I will die if I catch COVID-19. I am a 51-year-old male. Nothing is being done to prevent me from catching COVID-19 at all. This is from Tasha. I am currently at MOD 3. I was COVID positive. I was in pain. I had a fever over 101 degrees. They did nothing about it. When my test said positive, I was supposed to be moved as soon as possible. They did not move me right away. Though after my test came back positive, they still had me out for rec with the other ladies. I was taken to the detention center a whole day after the test came back positive. I was at DC for 12 days. We were in a unit with the mentally ill people because they had nowhere really to put the COVID positive people. I only came out 1 hour a day. On a good day, I might come out twice. We weren't able to wash our clothes over there. The lights over there never goes out. They had mice over there that looked like baby rats. It was so cold over there, I slept with 2 blankets and 4 sheets just to stay warm. Another inmate wrote this. I wouldn't wish this treatment on my worst enemy. This is inhumane. And makes me feel as though I'm less than a human. Thank you for listening, and may God bless you all.
Thank you for sharing, and we'll be up there. That's all I can say. Is that the last person to testify?
Yes.
Are there questions from members of the committee?
Mr. Chairman, this is Councilmember Kim.
Recognized.
Thank you very much. First of all, I just want to thank you for the hearing. It was a very important thing to hear, even though I think identifying a lot of the challenging issues. And we have, as you said, we have to be there. And especially, you know, it's our city workers. We have to be thoughtful, as well as the individuals who are represented. Ms. Pulliam and Ms. Santiago, I want to thank you sincerely for bringing your experiences forward. Again, if you could, if you have not already, but if you could submit your testimony to the chairman, it would go a long way to make sure that we can continue to follow up as we look to tour some of these facilities. And I just, you know, I wanted to thank Ms. Shubik Richards as well, you know, for your comments. You know, the only thing I might take issue with is, while I recognize the urgent need for staffing, and we are all on here recognizing the urgent need for staffing, GEO Group is a for-profit entity that's been responsible and in charge of prisons under their care, which have been heavily documented as among the most abusive and inhumane in history. And frankly, I think that some of their operations have been frankly criminal. So while I recognize that there's interest on behalf of the state legislature to address the staffing issue, they should address the staffing issue. They should not be looking at privatizing with an operation that has been so severely maligned at the you know, and you know, it took people dying and hunger strikes and horrifying things happening both to staff and to inmates in order for us to finally see how awful they have been. So, you know, if the state legislature is truly interested, they would be invested in staffing and supports. You know, they're the ones who took a messed up rent relief package. They made it absolutely unworkable on rent assistance. $150 million in rent checks should have gone out between July and December. And instead, they allocated the money to put it towards prisons. And I will not have that money go to GEO Group. I will not have that money go to GEO Group. That money should, if they allocated it to the prisons and took people's rent to pay for the prisons department, Mr. Chairman, I believe that they should be supporting the staffing. And that means that they can hire up with unionized staff per appropriate hiring procedures. And absolutely, I feel uncomfortable with the invoking of GEO groups in any context until they are fully investigated and held accountable for the past violations that they have committed, you know, with public dollars, which is what they use. But, you know, we don't need to go into all of that. I mostly just want to thank you, Mr. Chairman, you know, for the importance of this hearing, to pledge to be a partner. And I want to thank everybody who testified. Now, this was an intense hearing on my part. I have a lot to understand and learn, and, you know, we're there. And, you know, I know we got to move faster. So I appreciate the time to be able to do that. Thank you, Mr. Chairman.
Thank you. Thank you, Member Gim. Do I hear Member Green?
Yes. Thank you for a very engaging hearing. I've been in other matters, but I've still, because it's very riveting. Having friends and family and correction officers. I'm familiar with some of the issues that are going on at State Road. Just very riveting and representative challenges that people have opportunity to take care of some of those issues during budget. Thank you, Mr. Chairman. Look forward to joining you and other members of this committee. Going back to State Road, when I was in the DA's office, I had spent some time at State Road. And publication, look forward to other colleagues to go back to State Road.
Look forward to being enlightened by the trip. Member Johnson or Member Best? Well, if I don't hear them, I want to thank everybody and all the panelists for their testimony and their patience, but more importantly, for their insight. Oh, wait a minute. Okay. Chair recognizes.
Claire Shivak-Richards, thank you. I just want to thank Councilwoman Gim for really bringing, for saying her appropriate discomfort with my mentioning of the GEO group. The GEO group is, I would agree with her, a criminal organization in many respects, and the Prison Society does not endorse the GEO group. But I will also say that it is arguable that the conditions at State Road at this moment are criminal. People are dying. People are being assaulted. And to her credit, and there's a lot that I do not think, I think there's a lot more that could be done at State Road that hasn't been. I've kept my testimony concise for you all. But I will say this, to her credit and to your credit, Council, there are 25 new COs in the pipeline to be onboarded. But to onboard new COs and train them is a very long process. And we have an emergency on our hands. So it may be wholly inappropriate to think about bringing in temporary staff, but something needs to be done quickly. Something should have been done quickly before. And the process of onboarding new COs and training them is not quick.
Thank you for that insight. Are there any others to testify on this resolution? Hearing none, this concludes.
Wait, Councilman?
Yes.
I had a final comment, if I may.
Oh, Commissioner, go ahead.
Yeah, a lot of testimony has been given about coulda, woulda, shoulda been done. Myself and my team have been working tirelessly, and we could never refute how people feel their perception. We acknowledge it wholeheartedly, but we have not been sitting here doing nothing. We've been here throughout the pandemic. We've onboarded folks. It is not easy to recruit people during a pandemic. I think we need to be very clear about the challenges we're up against. But we have been doing our due diligence. My staff have been here around the clock since the pandemic. We are not working remotely. We are inside these facilities. We can't refute people's perception on how it is. We're just asking for a fair assessment and that we not be painted with a broad brush as though we're not doing anything. These are Philadelphians that live in our communities with us, and we have a vested interest in making sure. So a lot of it is what should have been done, and then it's the practicality, and you're dealing with human beings that can choose the profession of their choice. So I just wanted to bring that out in full transparency. So it's been pretty much a lineup about everything we're not doing right. But you don't get to a 6% infection rate with everything that's happened around the country doing nothing. And so I just want to put that on the record that, it'd be a transparent and an assessment that you will be able to come up and see firsthand. Certainly no one wants to be incarcerated if we're telling the truth. But, people have a right to write what they internalize and feel. But I'm just asking for an honest assessment and to acknowledge the hard work of me and my executive team to provide services under some of the most challenging times.
So with that, Commissioner, I want you to know that the one thing I pride our committee and my fellow members is that we listen well, and we have a ability to figure things out pretty much for ourselves. And we're not perfect, but we get it right a lot of times. And so we'll be up to see you, and we appreciate. I remember working with you during the height of the pandemic when there was no playbook for you to grab off the shelf to figure this thing out. And we were kind of trying to build a plane and fly it at the same time. So the numbers do speak for themselves, but we can always do better. We can always improve upon what we've done. And that's, I guess, the only thing that any of us can do. So with that, are there any others to testify on this resolution? Hearing none, this concludes the business for the Joint Committee of Public Safety and Public Health and Human Services. Thank you again for your patience. Thank you again for your testimony, and you'll be hearing from us.
Okay. Thank you.